probably will not be on for long today. I have a little bit of my anxiety. I don't know why. I'm gonna put in a couple hours of medical. Is that Hana? Certainly looked like Hana. What the heck? Oh, fingers and mesh. Okay. 1, 2, 3, 4, 5, 6. Alright, so I've got some cleaning to do. That'll at least help me get woken up a little bit. Ah, damn it. I hate when this happens. Where's my file for it? There it is. Leather pants. Oh my god. Oh, we're down bad. Oh, we're down bad. Eh? We don't even have any EMS. Oh, I just got the anxiety. Sounds like somebody's here. Yeah. Hello. Oof. Hi.
Hi, Indy.
Hi. Hello.
Hello.
Hi, how can I help you?
My friend here has a big bump on her forehead here.
Gotcha. Okay.
She fell off the dirt bike.
Oh, okay, I gotcha. I can take a look on you in here.
Right.
Here you go, just pick a bed, any bed.
Hello. Okay. That's the floor.
Here, I can help you under the bed. Just one
Yeah.
second. There we go.
Right.
Whoa.
Beating my ass.
Hello.
Oh, mate, he was beating my ass while I was beating his ass, and then he was beating his ass, mate.
We're all here for bandages and ice packs.
Yeah, my chest hurts.
I've been bleeding for the
Okay.
last 7 hours.
I haven't seen a doctor all day.
I don't think I've got any blood left.
Alrighty, yeah, I see this big lump on your forehead here. I'm gonna go ahead and use my little portable scanner here. Let's check and see if there's any kind of concussion or anything going on.
Thank you.
Alright. It looks like there's mostly just this bump here. But considering the size and the location, you might have just a little bit of a concussion. So what I'm gonna do, I'm gonna give you a little dose of mannitol.
Okay.
Yep, and all that is a medication that should help some swelling in the brain go down if there is any, okay?
Okay.
Alrighty. I'm just gonna roll up your sleeve here and give you a little quick injection, okay?
We'll try.
Okay.
Alright, there we go. There's a little bandage for that injection site there.
Bit of blood on you.
Oh, thanks. I fell off Mount Gordo a little bit.
Oh dear. That's not good.
And here's you a couple ice packs. Now these are refreezable. My recommendation is 10 minutes on, 20 minutes off, okay?
Okay. You
Alrighty.
sell med kits?
Yeah, we do.
All right, I want to get a couple.
Okay, 2 of them.
Yeah, no, I think two's fine. I don't think you need that many.
Yeah.
We did
Surely.
also get some special ones where we can have
Yeah.
a special band
Oh,
aid as
yeah.
well.
Yeah, if y'all want the specialty ones, we can make those. If y'all want just a standard, like, red box med kit, we can get those as well. Whichever you'd prefer.
I'm good for me.
Okay, let me go grab some of those standard med kits then. I'll be right back. What did that say?
Looks like that has stopped it.
Yeah, those band-aids
Alrighty.
really worked. Thank you, doctor.
Got these med
No
kits for you.
worries.
What is your
Alright, who needs
state
it?
ID?
Oh no, I'm okay. Thank you.
Alright, thank you.
19974.
Alright, here you go. There you go. 2 med kits.
Alright, thank you guys.
Yeah, of course. Y'all take care. Let's see. Apparently the DA is gonna come in to get her medication. Okay, it's the 200 milligram pills.
I don't know if I've done one of those. Setting up a prescription.
Okay, well then I'll have you do it. Do you want to run through a test medication right quick?
Yeah.
Okay,
I know
let's...
I've made medication, but I don't know if I've
Mhm.
done like a prescription.
Gotcha. I'll have you issue a test med to me as a prescription. That way you'll have practice and then you can do Miss Kai's when she comes in. Oh, we will have to do that later. What happened?
This one got ran over.
Oh no. Here, we can
Just
take him back
saw
to the...
you.
Yeah. He doesn't know how to ride a motorcycle. He's just learning.
Gotcha.
No.
Okay.
It wasn't even my fault.
He's just a little guy. Just doesn't know how to ride a motorcycle.
He is just a wee little baby.
Wee little cat boy baby.
What the fuck?
Cat boy. I think he's high off catnip right now.
Oh no.
Eleanor. Oh, Murder Kitty.
You've taken a big old noggin, bonk into the noggin. How did you come off? Just
Okay, so
too
that's fine.
fast, or you hit
There was
something?
nothing there, and then there was something there.
This probably could have been an
Nah,
observation.
I was
if it's
there the
not
whole time. He just can't
basically.
see.
All right, bro.
Hey, Micah.
Hello.
Or
What
you
the
can't ride
bozo
his
do?
motorcycle.
Oh,
Shut
yeah.
up, bro. It wasn't my fault.
I mean,
Well, let's get
he tends to go through
started.
windshields too, so I don't really know if like
Oh,
it
he
being a
can't drive either.
motorcycle
Yeah,
is
he
like
can't drive either. It's
Yeah.
really
Yeah.
bad.
I'm just going to do a very quick concussion test. You're
Bip,
very
bip.
Poor little guy.
cognitive and answering questions, but this is just to be
Bip.
safe. So I'm just going to shine this pen light in
Can
your eyes.
cats get concussions?
For
Anything with a
Um,
brain can get a concussion.
Yeah.
Oh, that's good to know.
Oh yeah, I'm fucking safe then.
I'm just going to
Nice.
Ow.
Brains are overrated.
just testing your people's reaction. Right, well that's reacting normally. Can you tell me your full name?
Ryu.
Is that your full name? Just Ryu?
Yeah.
No last name?
I have a last name. I hate saying it. Masaki.
Okay.
Hana, I'm gonna go check up on the ICU.
Masaki.
Just holler if you need any help with anything, okay?
Okay.
Hello.
What the fuck? What the fuck? Two raccoons.
Don't worry, Dr. Nancy. I'll be right
Jeez.
back.
They're good for 3 years. Actually, this is odd.
Unless
Dr.
you are
Farah,
free and
What's up?
this patient has been given a rabies shot.
That's not what I meant to hear out.
Nearly 6 months ago,
Uh-huh.
and then one nearly a month ago.
Double dosage,
Um,
thank God.
Sometimes if someone has a very bad attack from like a murder kitty or something, we might re-up their rabies vaccine.
Oh yeah.
Okay.
Yeah,
Yeah, there was a wild dog.
gotcha. Then yeah, that's
the shop
probably what it
couple
was.
days ago.
Because we do preventative, and then if somebody has a really bad interaction with an animal we believe might be rabid, then we re-up it on the spot.
That makes sense.
Yep, just being thorough.
Okay. Alright, well, Mr. Ryu, you are all
Thank
good to
you.
go.
Thank
How
you.
is the ICU patient?
Thank you, doctor. We'll be back in 5 minutes.
She's not conscious right yet. I'm giving her just a few more minutes to kind of get woken up a little better. We can take care of... It looks like Miss Kai is outside, so we'll take care of her prescription right quick, and then we'll both go check on the ICU patient.
I believe...
yeah.
Micah, you needed
What's
to be
up?
seen?
Yeah, I wiped out like 4 times off a bike yesterday, and I had on armor, but I'm feeling like really, really bruised and sore.
Oh, okay.
Okay. You wearing a
Here,
helmet?
let me get you an ice pack.
Yeah, I was wearing armor and a helmet.
We love a safe queen.
Hell yeah. Thank you very much.
Yeah, of course. Is that feeling better for you?
Yeah.
Okay, good, good. I'm glad.
Thank you, thank you. You guys have a good shift.
Yeah. Have fun. Stay safe.
I almost said you too. I am very tired.
I think I saw Saudi out here, but we'll see.
It is Friday, isn't it?
It is Thursday, but for me, it'll be Friday in like 2 hours.
Okay. So
Hi,
I'm
Saudi.
not.
Hey there, how are you?
I'm doing all right.
Hello.
Good, good. Let me give you the old bottle. It has stuff in it still.
Okay.
Yeah, she gave me stuff. I like it because, you know, sometimes it makes me feel a little, you know.
Mm-hmm. Yeah, this is the powerful stuff.
Yeah, but like I told her, I said, I don't take it all the time. So,
Yeah, of
and I
course.
said, I'll bring my old bottle down and show you.
Yeah, you're all good.
I only take it when I really need it. So,
Mm-hmm. Yeah, I can definitely get this, re-upped for you. That's no worries.
thank you.
Mm-hmm. I'm just gonna double check all my paperwork right quick and all that kind of good stuff. Then we'll get you, good to go.
Alrighty.
Would you like me to
It's all good.
check
We'll work
on?
yeah, if you want to go check up on the ICU, that's perfectly fine. I'll be along shortly.
Okay.
New doctor?
Yep, resident. She's my duck for the day. I'm training. Yeah, I thought when I started doctoring I would never want to be a trainer. And then they were like,
Yeah.
"You're good at your job. You're going to be a trainer." And I was like, "Okay."
I guess I gotta learn from somebody, huh?
Yep, exactly. What's your state ID, Saudi?
8723.
Let's see. Alright, I'm just gonna double check my bottles real quick here.
Alrighty.
Alright, I got my label a little funky, but it is 200 milligrams.
Alright.
I made sure to print that on there for you. So these should be your new batch.
Okay.
Just double check and make sure there should be about 14 tablets in there.
Yep, 14.
Wonderful.
Alright, I do appreciate it.
Yeah, of course.
And this will hold me over until I get in for my block.
Mm-hmm.
Alright, you have a great rest of the night.
Yeah, you too. Take care.
Thanks.
Oh, I've got the burps. I need to make myself a little cheat sheet. Oh, hey. Ooh. Oh. I nearly dodged it.
You
Nearly.
did. You did.
God, you clipped my shoulder.
Oh, I came here for a checkup because I think I have an owie that a doctor needs.
You have an owie?
I think so. I don't know.
Oh,
I feel
yeah,
like I
you
wake
you
up
have
and
an
I
owie.
feel sore.
Yes.
Oh,
I see your owie.
yeah.
Looks like you got a pretty bad bruise to your noggin and your torso. Here's a
Ooh.
couple ice packs.
I did fall off my. Oh no, didn't fall off. I was in like a little mini tornado on my butt.
Oh. Yeah, those are painful.
And then I flew off and hit like a wall.
Oh my god.
So, yep. It do be like that.
Mm-hmm.
What are you up to?
I've got a resident with me, so I'm training today. She's looking after an ICU patient right now. Have you met Hana?
Yeah, I met Hana.
Okay, yeah, it's Hana. She's training with me today.
Oh, okay.
Yep.
You're the only ones on duty.
Yeah, it's just me and her right now. Ember's supposed to come around later.
Oh, that's right. I just
Yep.
came to see why I'm so bruised up, and then I don't know. I'm just feeling.
Yeah. Well, congratulations on just chilling and all that kind of stuff.
Yeah.
I think today's gonna be a hospital day for me.
Yeah.
Yep.
Okay. Well, you do love the hospital.
Yeah.
Most times.
Most of the time. Some
Yeah,
days
other
I hate
times
this
it's
place
like,
and don't
ugh.
want to step foot in it. But today,
Yeah.
You know what? If I say I think it's gonna be an okay day, I'm gonna curse it. So it's going to be a
Yeah.
horrible day. Things are going to be terrible, and it's
Oh,
okay.
yeah.
Gotta put
Jeez
the energy
Louise.
out because it'll turn around, flip backwards, and come back. So hopefully put good energy into the universe. Alright, I need to go make sure my little duck ain't messing up or nothing, so... It's good to see you, though.
Yeah.
Yep.
Alrighty, I'll see ya. Let me know
See
if
ya.
you need anything.
Yeah, will do. Yellow.
Hi.
Oh, goodness. What the heck
Yeah.
happened?
Locals. Shooty, shooty.
Oh. Here, let's go in the ER. That way if there's any inside you, I can get them out.
They've been in there a while. There was no doctors for a while.
Oh, gotcha. But yeah, pick a bed, any bed. Which one would like to go first?
Alex.
Perfect.
Sure.
Alrighty. Yeah, I'm seeing a couple entry wounds. I'm just gonna make sure these are through and throughs, or if they're embedded, I'll get them out. So let me just check and see.
Alright.
Oh, I'm seeing a few in there. Alright, I'm just gonna take a quick little scan. Let's make sure that nothing's hurting anything vital. And we'll also see how many are in there. Alright, and good news. It looks like we're not seeing anything get nicked. It looks like you mostly took it to the... Well, for lack of a better word, the flesh, I guess? 'Tis but
Oh
a flesh
God.
wound. And I'm seeing
Eee.
2. Alright, I'm gonna get you a couple little numbing shots in here. And then we will get these removed.
Alright.
Alright, there is bullet number 1. Just gonna clean this out and get it stitched up. And bullet number 2.
Aw. That's adorable and tiny.
Mm-hmm.
Mm.
There we go. Give me just a sec to get a couple little bandages over this, and then I think you should be all good if you are feeling like you're all good.
Oh, yeah.
Alrighty, there's you some bandages. How's that feeling?
Much better.
Awesome.
Thank you.
Yeah, no worries.
Dr. Farah, can I get you to the ICU ward?
10-4, is it urgent?
I just need your opinion and permission to proceed. We've got a bad infection of the neck and continuous bleeding.
10-4, I'm dealing with GSWs right now, but I will be there as soon as I can.
Copy that.
Goodness, hon. Alright, I'm just gonna check and see. I'm gonna check on this left arm first. And we'll go from there. Alright, yeah, I'm still seeing it in there. I'm gonna go ahead and numb this area up and then we'll get it out. Alrighty. Let's go ahead and see if we can't get this removed. Alright, there we go. There we go, bullet number 1. Alright, I'm gonna grab a quick little scan of your torso here. I just want to get that location. If there is a bullet embedded in the torso. If it is a through and through, we'll go through and get it stitched up. Alright, I'm not seeing any fragmentation or a bullet. It looks like it might be just a through and through. Let's get that numbed up and stitched up for you.
I got also get an ice pack too because I got attacked by a bicycle.
Oh yeah, 100%, hon.
Oh, good. Yeah, the poor bicycles.
I saved it from a tree and then I tried to get on it and it said no bitch and it flung me across and I hit a building. So
Oh,
Yeah,
jeez.
we're doing fine.
Actually, you're not the first person that's come to the hospital after being attacked by a bicycle today. Apparently, they just have a vengeance for folks.
that's wild. There's a local bicycle, so maybe that's why.
Yep.
Mine's never done that to me.
Yep.
Do you know how to lock your bike? Can you?
I have no idea, actually.
I also don't know.
Alright, let's take a look at these legs here. Alright, it looks like you only had the embedded one up in your arm here. So let's get these numbed up, sutured up. We'll get you a couple bandages, and I think you should be good.
Nice.
How's that feeling for you, hun?
So much better.
Oop, I need to tighten these bandages. Give me just one quick second.
Hmm.
There we go. That should be a little bit better.
Nice.
Hello, hello.
Hello.
Alrighty, let's take a look. Alright, I see where you're grazed up here. I'm gonna quickly numb up this little area. It looks like you might have had a couple little burns going on. Have you had any treatment for those as well?
Nancy had a look at him earlier today.
Gotcha, okay.
It hurts, but it's not like massively painful.
Yeah, I gotcha. We'll get you some fresh bandaging and creams for those then.
Alright, good deal.
I'm sorry, doctor's hands, I know they're cold.
Sorry, sorry.
Alright, got those rewrapped for you. Put a couple of antibiotic and burn creams on there.
Appreciate it.
Yeah, of course. Same as your other friends here. I'm gonna go ahead and grab a quick little ultrasound of your torso. Just gonna make sure this bullet that went through isn't, nicking anything, hurting anything.
Right.
Yeah, of course. Alrighty. It's looking like the path the bullet took did cause a little bit of internal damage. As far as I can tell, there's nothing that's been fully punctured or anything that would require immediate surgery. However, you do still have a little sliver of a bullet in there, so I'm gonna get that out for you.
Alright.
Yep. And I would advise against taking any harsh hits to the stomach, torso area for the next couple days, just to give your body some time to heal, okay?
Alright. Do my best.
Alright, let's see if we can't get this removed for you.
Alright.
What are you handing me?
Hmm?
Ah, hi. Are you giving this to me or just...
What?
Alright, I think I got the little sliver out. So I'm gonna go ahead and do some sutures and just kind of back out of there and make sure everything's all set in order.
I love it, thank you.
Alrighty. Alrighty. I'm also gonna put a little ice pack here. They are the
Alright.
refreezable kind, so I recommend 10 minutes on, 20 minutes off. Just refreezing as you need, okay?
Alright, good deal, good deal.
Yeah, of course.
Oh, appreciate it. Should I come back tomorrow or something, or next few days to make sure everything's okay?
If you want to come back in, and we'll just grab a quick ultrasound, make sure everything's healed up fine, that'll be all good.
Alright.
Could I grab your state ID right quick? And I'll just write up a quick little medical report. That way, whichever doctor treats you will know what's going on and what to look for.
Yeah, 8444.
Perfect. I'll get that written up for you.
Appreciate it.
Yeah, of course. Y'all take care. Stay safe if you can.
You guys do, you guys do.
I'll try.
Yeah. Okay, so the ICU patient.
So the stitches on her neck are rather inflamed.
Okay.
And I believe a vein had been nicked, and it'd been steadily bleeding all night. So I got her a bag on AB positive because that is her blood type.
Mm-hmm.
And just because I couldn't really do anything myself, and because it was rather warm to the touch, I got a cloth of sterilized water and just held it on there just to cool her down.
Gotcha. Okay.
I did change the bandages as well, and I noticed that the bite on her leg is quite deep with some significant muscle damage. But the claw marks on the torso are decently superficial. But that neck I'm very worried about.
Gotcha. Yeah, if we have a vein that's been trickling, there's likely still a slight, well, an opening in that vein. It probably would be prudent to go in and reclose that, patch it in whatever way we can, and then probably get the patient on a drip of, I believe she's currently on azithromycin. We can do a drip of azithromycin just to kind of help ward that infection. Just to double check, has the patient been unconscious?
No.
No?
No.
We've been talking.
Okay, well, I feel bad. I've been talking over here thinking you were asleep. So that's my bad. I should have been asking how you're doing.
Feel a little better now. Like something. It hurt a little
I
less.
did get her some ketorolac.
Okay, perfect.
She was very not good when she woke up.
Yeah, I can imagine. I can very much imagine. Alrighty.
Yeah, I don't really remember how it came to be this way.
Let's see. The report says, just that you were brought in unconscious by police and treated by Dr. Nancy. But it does look like an animal attack of some sort. It doesn't say exactly what.
Okay.
Since you are awake and conscious, I have kind of two paths forward for you. Since we do have that leaking vein, that is a concern. What we could do is push TXA in the area since it is just a leak, and hope that the clotting factor will kind of resolve that on its own. Or we could take you back into surgery, and surgically reclose that vein. Since you are awake and conscious, it is kind of up to you.
What a nice young lady.
Whatever you think would be better. I mean, I trust you all.
Yeah, of course.
Hello. Sorry, I didn't want to interrupt you during your work.
You're okay. What do you need?
Well, I was trying to cross the road, but they really don't give you a lot of time, and I'm afraid I got bumped on the hip by a automobile. So
Okay.
my hip's a bit sore. Plus I'm old, so it's always a bit sore, you know.
I'm not alone.
No, you're not alone.
Got on duty, and I was like, I don't want to be the only one around.
Yeah, that's
There's
fair.
doctors. Yippee!
Oh, it feels much better. Thank you so much, doctor. Right, well, good. Good luck. I hope everything goes well. I know it's stressful. It can be in the operating room, whatnot. So.
Well, thank you. We appreciate that.
Good luck.
I think I would like to try the TXA first because we will know if it works or not in about 15-20 minutes. And then if
Okay.
it doesn't work, I think we could proceed with surgery. I would prefer not to go the surgical route first because, considering the vein is in the neck, that is a very fragile and delicate area. I would prefer not to have to surgically intervene there, if at all possible.
Okay.
Alright, so we will go ahead and push some TXA. It'll take a little bit, maybe about 15-20 minutes, and then we'll know whether or not that vein is going to continue to leak as it has been. And then we'll also get you on a bit of a drip of that azithromycin and see if that kind of helps that infection kind of pare down just a little bit. Alright, I'm just going to get this little IV set up with that antibiotic drip going.
Okay, just go ahead and do it. Funny being an EMS, I don't like needles directed at me.
You're all good. Needles don't really bother me, but anybody, like... Funnily enough, I can handle a lot of things. I can handle, you know, all the bodily fluids, with the exception of one, that being snot. It grosses me out for some reason.
Ooh.
And it's really the least bad one of everything. But I can't handle it.
I can't handle vomit. I'm a huge sympathy vomiter.
Gotcha, okay.
I think it's mainly the noise.
Yeah, that's fair. I'm also just gonna put a little bag of fluids here since you have been with us for a little bit. Don't want you to get too dehydrated on us. Alright. While we don't have a patient, knock on wood, Hana, I'm gonna run you through that test med thing in the pharmacy. If something crazy starts happening, Nora, you can always ping us through 611, holler very loud, or if the machines send a little beep to my pager, through the 611 system too, okay? We'll come check back up on you in just a few minutes. Do you want us to let your ECs know you're awake?
Yeah, why not?
Okay. Just to double check on my end, do you want to be accepting visitors at this time?
Yeah, sure, why not?
Here we go. Alrighty. If you need anything, just let us know. We'll be right here.
Okay.
Okay, so just to double check, you said you've made medications before, right?
Yep.
Okay. Did I take you, or did somebody take that through? Did you do that in the lab or in the pharmacy?
Both.
Okay, good. The only difference, really, from making a medication to giving out a prescription is you will need the person's state ID. Oh, hello. Hi, how can we help you?
Actually, I didn't know that there was any of you guys around, so she already got me the
Oh, okay.
ibuprofen that I needed.
Yeah, you're all good. No worries. Alright.
Yes, from PD.
Oh, wow, that was quick.
So I should be good. Someone dealing with some
EMS from PD. Hello. We're down on the Shank Street docks over by Little Soul requesting a
Oh, it looks like
52,
we have some
someone who
patients coming in.
drowned.
Yeah, I was gonna say that guy looks like.
76.
Cute.
Hello.
Hello.
Hello. What's up?
I just need to check over Nancy treated us before, but still not feeling 100%.
Gotcha. Just need some bandages tightened and things like that?
Yeah.
Gotcha, okay.
And I just need my knuckles cleaning up. Nancy didn't work on them. He punched the wall.
Which is never a good idea.
Gotcha.
No, I don't recommend that at all.
Have to vent a little bit. No.
Thank you so much. I appreciate y'all.
Yeah, it's no worries. How is that feeling for you?
There we go.
Thank you very much.
Really good actually now. I felt it kicking. Thank you.
Yeah, no worries.
Thank you very much. Appreciate it, Doc. Does my bad.
You're good.
Appreciate it. Take care, alright? Be
Yeah.
safe.
Y'all as well. Take care.
Alrighty.
Alright, what I'll have you do is prescribe me a medication. Yep, so you should just be able to go to Create Medicine. You're more than likely never going to use the option for the local nurse to refill a bottle or create an empty bottle.
Okay.
Almost always you're going to want to do a fresh prescription. For now, let's just say you're going to give me... Let's do just a...
Painkiller?
Let's do a glucose patch. Just one.
What is your state ID?
16257.
Doctors from EMS.
Looks good. Send it.
I have a 47 coming in. He drowned. He was originally unconscious and unresponsive. A bunch of water in his lungs. CPR was given. He's now awake, conscious, but still icky from drowning.
10-4, we'll take him in the ER when you get here.
Icky.
Okay.
Still icky. Oh, by the way, that reminds me. I know... what's her face? Sydney. At one point, last time I was training you, she said, like, oh, only the highest on duty answers the radio. That's bullshit. Don't listen to that. If you are available and can answer the radio, answer the radio. The only time, basically, you won't want to answer the radio is if you are 10-7, if you're in a surgery, or are otherwise busy. And then the only other time it won't be you that answers the radio is typically like if there is a PD thing going on, then the highest on duty would be the one that is talking with the PD.
Oh.
Yep.
I honestly don't remember her saying that.
Okay. She did. I did not correct it in the moment because she's a very needly person and I just didn't want to deal with it. So... But for the prescription, you should be able to check my profile, and it will now be under my listed prescriptions.
23 Eclipse 147.
16257.
Let's get this patient first.
Yep. But yeah, that's about the only difference. And the only other thing you'll want to do before you prescribe anybody anything is check their profile. Some people are recovering opioid addicts, but they won't tell you they are. So, of course, always double check someone's profile because they also might have allergies and things like that. But that's more of a kind of do it in the moment kind of thing.
Mm. Yep, there it is. Glucose patch. 10 grams.
You also will notice on your own profile under the medical section, you can see prescriptions given.
This is the man who drowned.
Gotcha.
I put him, he had CPR, he had a bunch of water in his lungs. I gave him some warm saline as well as put a little thermal blinky over him to help regulate his heat, but he's still a little woozy and out of it.
Gotcha. Thanks so much.
Of course.
Thank you, Bean.
Of course.
Did she say they got all the water out? Or...
I don't know. Let's take a listen.
Right. Let me take a listen in with my stethoscope. Just make sure all that water is
Are
out.
you self-transporting? Couldn't wait 2 seconds.
I'm not hearing any
Perfectly fine.
more water, which is good.
Switch over to a traffic enforcement.
They're feeling pretty warm.
Yeah, we can try. Yeah.
So they got warm saline into that IV, which is good.
Do you wanna rerun that 1038 call out with me?
Yeah. Sierra 33, 1038. It was westbound. I don't remember what street we were on.
And that blanket.
Okay, so Sierra 33, 1038, westbound San Andreas. Black and colored Guardian, occupied 4 times. Gonna get at least 177, please.
Jesus Christ.
If you want to be even fancier, you can throw in the crossroads, so San Andreas and Elgin.
They were
Or maybe
originally
like
on
the
the
Limehouse.
course. I don't know how
San
long they
Andreas
were
might have
on
traffic
for. I
circle.
just want to do
Right
a
after the traffic circle.
neuro.
Yeah, I don't know, dude. I'm gonna be honest.
See
What's
that
going
brain
on. Like,
activity, right?
I know.
If you want to, you can run through something similar to a concussion test to check for confusion. And then if you start sensing something bad's going on, then we'll give them a scan.
Too much about fucking up, and I'm causing myself to fuck up.
Mm-hmm.
So just do basic questions. Sir, can you tell me your full name?
Gabriel Callow.
I don't know this person, so I can't
I'm so confused. Are we doing
guess
test
if that
person
is
again?
correct. Can you tell me the color of the sky on a clear day?
Blue, like in Minecraft.
Oh, hey,
That works.
oh wait. I can ask a question. Yeah. When
What
for the
month did we
discretion of
just
helping
enter?
people up, but when like the normal, or is it
May.
kind of like use discretion really heavily?
EMS on duty, you don't do it.
Okay.
And then you can do whatever the fuck you want.
Right.
Oh,
How much
okay.
wood could a woodchuck chuck if a woodchuck could chuck wood?
I don't know. Your sister.
And
Good
obviously,
answer.
don't be doing it in like the middle of a shootout or something.
Yeah. I don't think he's got any problems neurologically, at least from the
Aw.
drowning, of course.
Yeah, of course.
Oh, actually.
No.
And if the lungs were clear of
Steven's
fluid,
gonna remember
we
to
can
carry-
probably just help him to his feet.
Yeah.
Park, trying to
Well,
cuff me?
did he get an antibiotic from
Okay, that's
the,
interesting.
what is it called?
What the fuck?
Pneumonia?
You're under arrest.
Is it pneumonia?
You are.
It is pneumonia, isn't it?
No.
We'll hold off on prescribing any
Wait,
antibiotics.
let me try again. Try and see if
what
you
we'll
can
do,
cuff me
if he starts
specifically.
experiencing any symptoms, we'll get treatment for him when he comes back to us. If he starts developing pneumatic symptoms.
Okay.
Yep.
Alrighty. Let's make sure he's nice and comfy.
Soak up in you, Stevens? Okay, what if I step back?
There we go. How do you feel?
On rock and roll.
I feel better.
That's good.
Oh, he isn't.
They tried to kill me.
Oh, goodness.
Well, that's not good.
No, that's not good at all.
Oh my god!
What the hell? Someone.
I don't want to know.
In pain.
I don't want to know.
Hello.
Oh, goodness.
No, not
She's been
again.
screaming in pain and stuff. I didn't want to read her right. I did the okay.
Oh, there it is again. All right.
I did
Go
the-
ahead,
I
Hana.
did
I'll
the
finish up
very-
with Mr.
the
Callum.
very
Okay.
minimum that was needed to just secure her. And,
How you feeling, sir?
sorry.
Tired.
Tired? Yeah, I bet so. I would recommend taking it easy for the next day or so, considering what you just went through, okay?
They threw me in the water.
Well, I'm sorry to hear that. If you start developing a cough or anything like that, please do feel free to come back and see us, because you could potentially get some pneumonia, okay?
Okay.
Alrighty.
Sorry, we were staying with them, so
That's
that's
fine.
why I didn't have the
Let's
cannon. Also, I did not get a
get you all
picture of
washed.
them
punching out
doing
back
the
and
ATM at all.
I got it. I got it.
Let's wash the
Okay.
washed.
Was it them?
Oh, what
let
the
me
hell?
double-
You know what?
Because
I'm just gonna make
in
sure
my
these are
picture, I only
covered.
have.
What did I do?
What do you mean? Because you ran
I
from
only have a
us,
picture
sir.
of one,
No,
and
I
it was the
didn't.
one with like long.
Yes, you did. I'm
She
gonna
did.
double
She
retitle
does
these
have a
stuff, okay?
crowbar
Scale.
in her possession.
1 to 10.
They them
with
he
medication.
him. They had a crowbar in their possession.
Yes, they. Sorry.
All right, let's go.
I did.
Nah,
I said
they
didn't I?
they were passenger.
No.
They didn't do anything.
They
I
them
got
he
Give a
him.
road chase.
Mm-hmm.
They were.
I remember.
Yeah, they were passenger.
So I don't know if you remember me, but I remember.
Kim, look at that report
I
number.
think I remember.
Okay.
I don't know. I this pain.
You know, in my picture there was two, but I don't believe that it was them.
Let's make sure that nothing's
Oh, I caught her last night
broken
for
as
drug
well.
dealing.
Yeah.
They, them. My bad. That's my bad, OG.
Oh, stop being a big baby.
Yeah, I don't think they were one of the ones
Fwa, fwa, fwa.
doing the ATM.
What the hell did you just call me?
No, they
You're
were
a big baby.
There's a long blonde-haired one and someone else, but I did not.
No, Bear's
In my
baby.
picture, they're kind of
Bear's an
obstructed
adorable
by the
baby.
bus stop. So
Bear
I
is
can't see
baby.
who it was.
Bear is a very
no,
good,
I got a
good
picture of
baby.
both of them who hit it, and it was
Alrighty, this
them.
is all
They were
cleaned
just
out.
passenger
Get
seat.
you some bandages.
Just from passenger.
Now let's
Also,
make you all nice and comfy.
should I
Sorry,
go?
go ahead. No, you go.
No, as in if somebody's carrying somebody, it's no,
It's wonky.
yeah, it's just one.
I think you handcuffed both of them somehow.
No, we just did testing.
Oh,
Oh,
Indy,
okay.
I did not tighten the
I
bandages
definitely
on
cuffed
Mr.
her,
Callum.
and
I did, don't worry.
Ah!
Bark! You're scaring me! Bark!
Oh my god!
Oh,
Oh my
person.
god!
Oh,
Oh
this
my
is
goodness.
awful.
my
god.
resident!
Oh my
Man.
god!
It's fine. I
Speaking of
got
note
you.
Nancy gave me.
You know, I was
to
just
take
Oh my
testing.
god.
it. That was a
What the
test.
hell?
Also,
I
Hana,
cannot
you're
believe
washed.
that she
What the
is
hell?
washed. Oh my god.
The note Nancy gave me.
I was
very bold
freaking
moves
out at all the
also
dog.
amazing.
Yeah, I'm washed.
Do better.
That's what Nancy said.
Turn around.
Wait, where is the note at?
Hold on, I'll text you.
Give me your hands.
That's funny.
I mean, hems.
So did they not even
Memes.
leave the store?
No.
Oh my god.
DEVEREUX.
Alright, what we doing?
We're ready? Well, do we have anything to charge her with?
Hey,
They, them, he, him.
what did we just say?
Do we have anything to charge them with?
If there's nothing in their possessions, they're
No.
No, they just had a knife that I currently have in possession.
Uh,
that they can have back.
you just go right there.
They were just in the car and flew out of the car.
Yeah.
You just go right there and
Oh.
say, being a passenger for this, and then
Oh, I'm fair. Watch them. Our people, let's discuss.
Our people.
I've got a law book.
Wait, they didn't take mine, did they? Oh, they got their own? Oh no. I think that's stealing.
Oh my god, theft?
Good dog. You tell them, Bear. Can I get some glucose tablets, please?
Yeah, of course. When we get a break in patience, we'll go grab something to eat.
We're about to hit you with the law.
Oh my god, was that
Oh my
you?
god.
That was me.
Oh my god.
Bro, I got lit up so bad and I was still nothing. I dropped one of them.
but I'm so cool watching over you.
Oh my god. Did you get it looked at now after?
You're
Yeah, I called the doctor and they're very angry at me.
Oh, okay. Thanks, doctors.
Of course, stay safe. Alright, let's check up on Nora, make sure she's doing alright. Hey, Nora.
Hi.
Alright, I'm just gonna check over that neck wound. Let's check and see how it's doing. Alright, judging by the blood on this bandaging here, I really don't think it's slowed down any. We're probably gonna have to take you into surgery and do a quick little... Probably I'm just gonna attempt to tighten the sutures that were put on it. And if that doesn't work, I'll probably need to just kind of cauterize that little vein there.
Alright.
Yep. It looks like we have a couple patients, but you are next on my list once I get them taken care of.
Okay.
If you need anything like food or anything, just let me know and I'll grab it for you quick as I can, okay?
Yeah, not immediately, but I'll need food soon.
100%. Were those people, like, needing anything? Or just, like, some bandages?
Just some bandages.
Okay. Hi. You're available on the City Hall app. Sorry, that's one of my absolute favorite things to do to residents.
No, I'm not.
Fix yourself. Be better. Hey, Micah.
Hello.
Hi, Micah.
Hello. How are you?
Sore.
Sober.
Hmm.
What are you doing?
Really confused, but you know, things could be better.
What were you doing?
Yeah, I thought I was in bed, and then I woke up here. So I don't know.
You don't know?
I actually don't know. I don't remember.
Weird.
I know.
How'd you get eaten by an animal?
I know. It's wild.
Here. Hana, let's go, we'll grab the illusion and go get some food to fill up the fridge right quick. And then when we come back,
It's good you woke up.
Why is that?
we'll take care of things.
Because if you didn't, I would have had to raise you and kill you myself.
Oh, hello. Can we help you?
Dr. Payne 1041.
Oh my god, you're just in time.
Hello.
Hello.
Gotcha, okay. Let me
What am
get
I
you
just
a
in
couple
time
little
for?
bandages. Here we go. How's that feeling for you? Yeah, of course. Anytime. Ooh!
There she goes.
Through the doors
There
and
she
everything,
goes
dog.
again.
Well, you are just in time. Have you looked at Eleanor/Nora's ICU intake report?
No.
Okay. She got hurt by an animal. We're thinking murder kitty, but that's not confirmed. She has a vein that's been leaking on her. We're about to have to take her into surgery, as soon as we get back with some food, because she's hungry and we're hungry. I was thinking of running down to Payne's and... Actually, I think Tito's is open. Let me see. I might do a call-ahead order, depending on... Well, it depends on who's working Tito's, actually. Oh, there's a lot. Okay. So there's 4 of us now.
Hi, Indy.
Hi, Holly. Are you down at Tito's by any chance?
I am.
Okay, could I do a call-ahead order for the hospital?
Yeah, I can deliver it to you if you need.
Oh my god, you can deliver... Oh, I would love you forever.
Yeah. What do you need?
Could I get... There's 4 of us on duty, so could I get an 8 and 8?
Yep.
Perfect.
Any
if
preferences or just whatever I can get?
If I could get one thing with, or 2 of them actually with vegan substitutes, I would
Yep.
appreciate that.
Yeah, absolutely. I can do that.
Awesome. I appreciate it.
No problem. I will be up there as soon as I get everything cooked up for you.
Sure thing.
Alright.
If I don't accept the charge right away, I might be with a patient, but I will get it
That's fine.
sorted money-wise whenever you get here.
I mean, I can do that now if you want, if you're not busy right now.
Yeah, I'm not busy right now. That would be perfect, actually.
What's the ID?
16257.
16257. Okay, I'll send that through right now.
Perfect. Thank you, Holly.
You're welcome.
Alright, good morning.
Bye.
I love Holly so much. She's a sweetheart. But
Yep.
hello, Jessica. How are you?
Hello.
Hello. I feel like I've not
So-
seen you in forever.
I know, right?
Yeah. And to think I nearly didn't come on duty today because my anxiety was running me up a wall. But apparently there's not been doctors around like all day today. So people
Oh.
are coming in to get bandages tightened and bullets pulled out of them.
Gotcha.
Yep. It's been pretty steady. But how about you? How was your day?
Busy.
Busy?
I'm tired.
Oh yeah, I bet. You sound a little eepy.
Mm-hmm.
Oh, that's so expensive. It's okay. Doctor paychecks are good and we can afford these things.
Mm-hmm.
But yes, Nora's gonna need a surgery. It should just be a quick repair.
Or is that the wrong? I don't remember what earpieces was. Losing my mind.
But we shall see.
Okay.
Yep. If you want to do the surgery, you're welcome to, or if you want to hold down the ER, I'm probably
Yeah,
gonna have.
I'll hold down the ER.
Okay. Because I'm gonna have Hana do the surgery, and then just me kind of be there supervisorily.
Yeah, good idea.
Yeah. Hands-on experience.
And she's getting training,
Mm-hmm.
which is good.
Yo. Where did Hana go, actually?
I don't know.
Looks like she's in the break room. I really need to sharpen up. I've been losing track of my ducks each time I have one. So I was gonna have her add the note to her medical report. And just have her do all the paperwork. Because then that's something I can check off on her training list.
Yeah, yeah.
Yeah, yeah.
I'm gonna start some homework on my phone.
Yeah, you're all good. Oh yeah, I forgot you were doing training on the mainland, that's right.
Yep.
Yep. Alright, I will not bother you too much then. I'm gonna work on this report.
Oh, I mean, you're good.
I know, but you know what I mean. Alright, I'm just gonna pull up this report on my other monitor. Oh, hey, Hannah. If you don't mind, could you fill out a note on Nora's medical report? Just running over what we've done so far. And then when we do the surgery, we'll, attach
Amend
that
it?
report. Yeah. Appreciate you. Thank you. Hello.
Howdy.
Oh, Jesus. I did not
What?
recognize you two.
What do you mean?
I was like, this is either about to be trouble, or these people are gonna be fine. And then I realized it was you.
Yeehaw. Or something like that.
Yeah.
Yeehaw, or something like that. Indeed.
Or something like that.
Yeehaw.
Did y'all just come by to show us your outfits, or do you need some medical?
I
Well,
need
they
some
may need
medical assistance.
What
I think it was. I
happened?
don't know. I actually don't know which bozo did it, but now I feel like I got a little bit of bruising on my torso. It hurts.
Yep, here's you an ice pack. How's that?
Much better, thank you.
Yes, of course.
I keep
of
getting
course.
tackled today.
I see, I see.
I didn't do nothing. I swear.
Mm-hmm.
Mm-hmm.
Help. Help.
Oh, help.
Help. I got run over by a car yesterday.
Oh,
I got
Jesus.
told to come back today because I had a fractured rib.
Gotcha.
Hello.
Let's go get you a quick little x-ray.
Alright then.
Okay, I'll be there in like 5 minutes.
That's my
Oh,
specialty.
this way.
Wow.
I'll be there, bye.
Jess, would you mind to let Holly back to the fridge so she can give us the foonch?
Tonight?
You're all good, hon. I was talking to, Dr. Payne.
Oh, okay, sorry, I didn't hear.
You're good, no worries. Why is my radio volume so... Yeah, if you just have a quick lie down, we'll get a little scan and we'll see how that rib's going for you.
Okay.
Yep. There we go. Also, what's your name, hun? I don't think I caught it yesterday.
My name's Lily Rose.
Lily Rose, okay. Well, it is a pleasure to meet you, Miss Lily Rose. My name's Indy, or Indigo, but most people call me Indy.
Nice to meet you.
Alrighty. Well, I've got good news. It looks like everything's healed up just fine.
So I'm not gonna die.
Nope, you're not gonna die.
Okay.
Here, I'll just move that so you're not gonna bonk your noggin. You should be all good to go.
Thank you so much.
Yeah, of course. Anytime. Now that's gone. Indy has food.
EMS from dispatch. EMS from dispatch on channel 19.
Send it. Oh, hello. How you doing?
Tired.
We have a
I
911
may or may
caller
not have
calling
spent
from
9.5
Limitless,
hours
saying
playing World of
somebody has
Warcraft
passed out due
this
to
morning,
possible blood loss.
Oh,
and I may or may not have crawled in bed
Tonight
until
the 20th?
11:30 a.m.
Limitless up at Harmony.
What is sleep?
True.
10 I can 76.
Thank you.
Alright, Hana, how's your note taking going?
There are no
Many
visible injuries on the
interruptions,
individual, but the person
I'm
found them
still
thinks
going.
that they've been bleeding for a while.
Damn, I was hoping for sticks, but they're not open.
Hoping for what?
I wanted to go get sticks, but they're not open.
Oh, gotcha. I'm gonna run and give this food to Nora, then we'll probably
So my
go
choices are
into
the pit stop
surgery.
or Tito's Tacos.
We actually just had some Tito's delivered in the fridge if you want some.
Oh,
yeah.
Alrighty, I've got you some food. Are you okay with tacos and a aqua fresca?
Dr. Pendragon's 1041.
Welcome aboard. Oh, who texted?
Alright, sorry about that.
You're all good. I've got you some food if you'd like some. Are you okay with
Thank you.
I think it's tacos and a pineapple aqua fresca?
Yes, very good with that.
There you go.
Oh my god.
You're all good.
It's one of those days, I guess.
Mm-hmm. Alrighty. It will likely be me and Hana taking you into surgery for that vein that's still kind of leaking on you. I just wanted to kind of walk you through the surgical plan we've currently got in place. You can yay or nay anything since you are conscious, alert, and aware and talking to us. Is that okay if I just walk you through that right quick before we take you back?
Yeah.
Of course. So, Hana will likely be taking lead. If that's something you're not comfortable with, I can do the surgery. But even if Hana is doing the surgery as the lead surgeon, I will be there in an observational capacity, since she is still a resident. But the current plan is to go in and tighten any micro sutures that would have been put in by Dr. Nancy. And in tightening those, it is our hope to stop that leakage that's happening in that vein. If the micro sutures cannot be tightened, or if Dr. Nancy did not put any, we will likely go through and attempt to either cauterize or patch that vein, depending on the severity of the leakage once we get inside. As far as I know, there are no other areas that required surgical intervention. Let's see. There was some puncture wounds to the leg, and there was some deep muscle damage there. While we are in surgery, I will likely take a look at that since muscle and bone is my forte. I likely wouldn't have Hana do it since it is a very deep puncture. If that requires surgical intervention, we'll likely do both surgeries in one go. If it does not require surgical intervention, we will very happily leave it alone.
Okay.
Yep. Is there anything you want to veto, yay, nay, questions, concerns for me to answer?
No. It's pretty simple to understand. And I don't really have any concerns with who's doing the surgery.
Alrighty, perfect. I will likely go grab Hana. We'll get your IVs set up out here, and then we'll get you transported to surgery, okay?
Okay.
Radio check.
10-2.
Dr. Sean is 41 and going on call.
Welcome aboard.
So many doctors. I feel so bad. I'm probably gonna go 42.
Yes, our only EMS, Nor.
I fucking love being around when there's doctors, but I'm so tired.
No worries,
Go to
hun.
bed.
Get some sleep.
Get you some rest.
Fully plan on it. I am exhausted.
Well, we hope you rest well. Have a good night.
You too. Good night, going. Well, I still gotta drop my Amber off, but good night, guys, and I love you.
Oh my god,
We
good
love you
night.
too.
We love you too.
Good night.
Alrighty, Hana, I've prepped Nora. We've gone over the surgical plan and things. So what we're gonna do, the current plan is to fix up her IVs in that room. We'll wheel her gurney into surgical room, the further one, the big one. And we'll proceed from there. Real quick, before we do that, I'm gonna walk you through the surgical plan. If you have anything in there that you're not comfortable doing, just let me know. And we can work out who's gonna do what once we get back into the surgery wing, okay?
Okay.
Alright, come with me. Alright, so it is looking like the only main concern, well, there's two actually. The leaking vein, of course, and then there was some deep muscle damage to the leg. So, primary concern is that vein, because obviously it's leaking. We want to take care of it. The TXA did not work, which likely means the flow rate is high enough that the blood was not able to clot, even with that assistance from the TXA. So, the plan is we're going to go in, we're going to take a look at that vein, we're going to see if Dr. Nancy did any microsutures to it, because as of right now it does not look like she did. It just says stitching wounds closed. So there's the potential she did, there's the potential she didn't. We're going to look over the vein. The first thing we're likely going to attempt will be microsuturing using that Da Vinci robot that we have in there. If that does not work, yeah, the Da Vinci. If that does not work, we will move forward with either cauterizing the vein to close that wound, or if it appears to be too large of a thing to cauterize, we will go in with a graft.
Yeah.
Yep.
I have grafted a artery before on that Sally Makeda.
Alright, veins are actually much easier to graft than arteries, so you should be all good.
Yep.
A lot lesser of a flow rate through a vein.
Yeah, and it's not constantly like shooting out like pump.
Exactly. The other
Very
thing I
steady
want to... Yeah, exactly. The other thing I want to look at while we're in surgery is that muscle damage in the leg. If it requires surgical intervention, we will likely go in and fix it while we already have her under. That way we don't have to put her under a second time on a different day.
Yep.
I don't know the extent of that damage, so it will likely be a open it up and see, and then progress from, well, it'll be take a scan while we're in surgery, see if it needs surgical intervention after we fix the vein. And then if it needs surgical intervention, I can walk you through muscle repair. Because that is also part of my orthopedic specialty, is muscle repair. Bone repair, muscle repair. I've walked through this all with Nora. She is perfectly okay with you being the lead surgeon, so you are going to be the lead surgeon on this. I will be your secondary, so I'll be handing you things, monitoring vitals, all that kind of good stuff. And if you have any questions, of course, ask me, okay?
Okay.
How's that sound?
Perfect.
All right. Well, Miss Lead, go ahead, go get your patient prepped for surgery.
All right.
We're about to head into surgery. If y'all two need anything, just holler over radio, let me know, okay?
Okay.
We gotcha.
Yeah, y'all.
I'm still doing homework on my phone.
Yes, just let me send one final message.
What was that say?
I'm just sending one final text message.
Okay.
Alright, there. We're good to go.
No worries. Yep, we're going to get you transferred over to this gurney. Miss Rain, if you would like to back up a bit. Thank you.
If you want to come, you're welcome to, Micah.
Okay.
to get this mask on you. I just want you to take some deep breaths in. I want you to count down from 20 for me, okay?
Okay. 20, 19, 18, 17, 16, 15.
All right. Let's get started. So first that we're going to reopen that stitching that Dr. Nancy did, and we want to look at that vein, see if Dr. Nancy did any work to it, or if she just closed up the area. I'm not seeing anything here, Dr. Farah. She didn't do anything.
Alright, that sounds like Nancy. We'll go forward with the plan we talked about.
Okay. I am going to try to begin to micro suture. We're going to use that lovely Da Vinci. I'm going to see if this holds.
Alright, her vitals are a little bit low.
Alright, let's increase.
Let's see what exactly is looking low. Is it respirations, heart rate, blood pressure? Or is it a combo of all three? Alright, her O2 respirations are looking good. We've got a little bit of a low blood pressure and a low heart rate. Do you have anything you would like to push? Or would you prefer some recommendations?
I would prefer recommendations, but I'm thinking...
You're all good. Tell me what you're thinking.
Yeah, the first thing that came to mind was adrenaline, but I'm not sure.
You're all good. Adrenaline is a good option. I'm going to tell you a slightly better option, and it's one I learned less than a week ago. So, if you put someone on a steady drip of dopamine, you will slightly increase the heart rate, and by increasing heart rate, increase blood pressure.
Oh goodness, I wish I was on a constant drip of dopamine.
Dr. OK actually taught me that one because she's a cardiologist. Yep. So, either or, this patient does have a healthy heart, no history of anything going wrong with it. So, pick your choice, stick with it. Either option is viable, okay?
If it's only a little lower than normal, we'll go with the less drastic one, which is that dopamine.
Sounds good. I'll get it started for you.
I've just got my little clampy fingers in the Da Vinci.
Yep, you focus on that. I'll set up the drip.
Going crab mode.
Going crab mode. Jesus. Alright, let's see how these vitals are doing after that drip of dopamine is started up. Alright, looks like the vitals are normalizing.
Okay. I think I've done with the vein. I just want to see how that's holding. Oop. It's holding very well. Alright. Let's... Let's close up the area.
19412.
Guys, do you mind removing the mask, please? This is a government facility. Beautiful. Thank you.
Alright. All done. Now we just need to look at that leg, see if that needs intervention.
Yep. Go ahead. We're going to use our little portable CT. Grab a quick scan of this leg and see if that muscle damage needs any kind of surgical intervention.
Yeah, that's in position.
Mm-hmm.
Ooh.
Yeah, that's looking a little rougher than I actually anticipated. It would probably be good to
That's
get
not
some...
gonna heal right.
Yeah. Alright. Based on this scan, I'm gonna walk you through what I would do. Let's just check and make sure there's not anything super specific, or is it generalized kind of torn muscles here? Or punctures? Just double checking the little scan. Alright. It's looking like a tear here. You can see kind of where this musculature has been kind of the frayed ends. Mm-hmm. So we have some specialized sutures for muscle tears. Basically, they act like little anchors because muscle is a fibrous tissue. And the last thing we want to do during surgery is put in very, this is going to sound weird, but very thin, very sharp sutures. Because since muscle is fibrous, it can just tear it further if we're not careful. So for muscle tears, we use a very flat, and for sutures, it's thick, type of suture that has little kind of arrows on it to assist in anchoring the muscles back together. It kind of looks, you know what, how to describe? I'll just show it to you here. But you can kind of see like the little arrows and like it has a kind of thinner end and a thicker end.
Oh, yeah.
Mm-hmm. So basically what you're going to do is where this muscle is torn, we're going to clamp it in place and then suture it with these sutures here. So I'll assist you in the placing of the clamps and then I'll have you do the suturing, okay?
Okay.
Mm-hmm. Because we're going to want to realign this carefully so we can have the muscle eventually grow itself back into proper alignment.
Yeah.
Yep.
Right. Let me know when to start.
Yep. Shouldn't take me but another minute here. Alright. Here is your suture kit. Feel free to go ahead and get started.
Alrighty. Go. I don't think did that right at all.
You're good. Muscle is thick, and it is fibrous. It's more difficult to get through than skin. You're alright. Let's just try it one more time.
Ah. That's better.
There you go. You gotta be just a tad bit more forceful with it.
Yeah. Oh. I got the hang of it.
Yep, there you go.
Alright. I think that is all done.
Sounds good.
Now we just got to make sure that skin's closed.
Now that those vitals are kind of stable and have been for a bit, I'm going to get this dopamine off of the IV here. We'll keep everything else going.
Right?
Yep.
I'm all done. Now did you administer the reversal agent?
I think we had her on a mask, so we should just have to take it off.
Okay.
Yep.
There we go. Let's get it back to the
Sounds good.
She's doing something for sure.
She's
yeehaw.
perfect.
Howdy, 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 partner.
I am perfect.
Looking nice. Alright, I do have the medical report started up, Hana, if you want to start putting down your synopsis while we wait for Nora to kind of come out of the anesthesia.
Indy, when do you think she'll be able to be discharged?
We'll kind of see how she's feeling after the surgery.
Okay.
She did have some damage to that leg. Hang on, give me 1 second. Yep, she did have some damage to that leg. So she might want a cane or a wheelchair or some crutches for a little bit, depending on her pain level. Because there was some muscular damage there. Or if she feels like she would like to stay, considering she did just go through a secondary surgery, we'll kind of see how she's feeling when she wakes up.
Okay.
Mm-hmm. My recommendation would be... Oh, well, I'm not going to talk over the patient herself.
No, go on.
Nah, you're good. You just got out of surgery. It went good. We were able to get that vein closed up for you. And that leg, the muscle did have some damage. We did have to intervene surgically, but that also went well. We didn't have any complications getting that fixed up for you.
Okay, I'm a little sore, but I don't know if that's just because, like, the Cadillac's wearing off or what.
Mm-hmm. Yeah, unfortunately, that is to be expected. We'll get you on a little pain medication drip. Probably not Ketorolac, considering you were having the bleed. But let's give me just a second. Do you have any allergies to any kind of medications or anything like that that you know of?
Not that I know of.
Strawberries.
Yeah, it's just strawberries. So unless you're putting strawberries in me, I hope we're good.
No, I've got no intentions of putting any strawberries in your IV. is up with that very growly dog?
Come on, we're gonna go back here. Away from the dog. Lay
Okay.
down in his bed for me.
We probably won't put you on... Well, actually, now that we have you sutured up, an NSAID should be fine, so we probably will put you on a little bit more Ketorolac. That should help with any swelling in the surgical sites. We're also going to keep that drip of azithromycin going, since that is a pretty powerful antibiotic. That should assist with any lingering infection from that animal attack.
Okay.
Yep. So, my question to you, are you feeling like you would like to be discharged today, or would you like to stay with us another night or two to make sure things are going as intended?
I mean, I don't feel great, but I don't feel like I necessarily need to stay.
Mm-hmm. It is entirely up to you, which is why I'm asking. My recommendation would be maybe a downgrade from ICU to observation. Meaning you would sleep here tonight to be monitored, but you would be free to go otherwise. Simply because that infection is still ongoing. And you did just have a muscle repair done, so you might have a little bit of weakness in that leg. However, if you would like to be discharged fully, I mean, you are an EMS, you're around the hospital often, and you know who to call if you get in trouble. So I would not be, you know, very, very against you being fully discharged if you feel like that's what you would like to do.
Yeah, I'll go with your recommendation of observation just because I feel like if I leave the hospital right now, Sasha may or may not kill me.
That's fair. Alright, we'll get you downgraded from ICU to observation, just so we'll have local nurses keeping an eye on you, and we'll keep an eye on you. Maybe just for tonight, we'll see how you feel tomorrow.
Okay.
Awesome. Alright, we will get that done. As always, if you need anything, just let us know, okay?
Alright, thank you.
Yeah, of course. Anytime.
Did you want to go somewhere and come back, or did you want to stay here?
Can I do that?
Oop, that's my bad. I was trying to grab up my little resident. You can
Yeah, she
absolutely,
said-
since you're in observation, so long as you come back for the evening to rest here, you're free to go wherever you wish.
Okay, I'm okay doing that.
You should use a cane, though.
Oh. Fine.
Here, we'll go out in the hallway.
You'll look super cool.
What's up, Theo? You okay?
All the cool kids use canes these
Yeah,
days.
just watching.
Gotcha, gotcha.
This smile on my face is how my face always is.
Hey there, Andy. How you doing?
Doing alright. How are you doing?
Pretty good. Got
Good.
roped into something interesting, so here I am.
Yeah, I can tell. Cowboy night tonight, huh?
Yeah, I guess so.
Nice.
No. Hey,
I
Micah.
don't know what you're talking about.
I'm being bullied by my friends.
It do be like that.
True.
You do be like that.
Hey, Indy.
Yeah, what's up?
Can she change her clothes really quickly?
Oh yeah, I gotcha. There you go.
Thank you.
Yeah, no worries.
Nice. Thank you, Indy.
Yeah, no worries.
She'll be back.
Indy, you free?
Yeah, 10-4. What's up?
Hannah's got a patient and I'm not a trainer.
On my way.
You know, they get shooty.
Goodness.
Hi.
Y'all have just not been having a good day.
No.
No, we have bad luck
Locals get so
with a lot of
shooty.
things.
At least it wasn't gravity.
True.
True.
Unless you count how gravity affects the bullet.
Speaking of frequent flyers.
Oh my god.
Hello.
The second he said
Oh my
you,
God.
he just started bleeding even more. It's
Get
terrifying.
over
here. Oh my god.
Oh my god.
Help. Help. Help.
Help.
Me and you are gonna have a conversation about your husband.
What?
Where is he?
We need him.
Where is he?
We need him. I don't think who you think I am.
Thank you.
Oh, Walker's bloody as fuck. Oh
Please,
shit!
I need help.
I thought
My
that
legs.
was Oscar.
We'll help you.
You just kidnap a random guy.
No, you moron, it's not Oscar.
That was fucking Oscar.
I was wondering what you were doing.
I was wondering why you weren't saying anything.
I'm sorry.
no.
Your hairstyle and your hair color is very similar to my fiance, who's also a doctor
Sir,
here.
I apologize
Oh
for
my god.
my behavior in the
Change his
hospital.
haircut.
I respect the patience, though.
No, he's been a doctor here a long time.
I was wondering why he sounded different. He was just like, help.
He's the prince
help.
of this hospital, I fear.
I was about to pull my gun on you, hun. Please. Please double check the person you're kidnapping before you yoink them out of a hospital.
Oh,
God
sorry.
damn.
I'm
Gosh, you scared the
bleeding. I need
crap.
medical attention.
Yeah, come
Do
on.
you?
Come on, we'll get y'all medical.
Sorry, not Oscar.
And if you want me
Wow.
to walk out in the lobby and make sure as well.
You're
such an idiot.
Go ahead and lie down.
Uh,
Jeez. Just
What the fuck?
yoinking people.
Although, question.
Hmm?
Oh my.
I guess to
Answer?
protect myself from what you're doing. Do you sell first aid kits?
Yes. We even sell specialty ones. Like gay
Alright,
ones.
here you go.
And pickles.
Do you have regular ones
Oh,
too?
Here's
mustard.
some
Or is it
bandages
just
over
the
those little bleeding
specialized ones?
areas.
Which ones?
I also got stung by a bee.
Like regular first aid kits or just
Yeah,
the...
Stung by
yeah,
a
we're gonna
bee?
do regular.
Oh
Yeah.
no.
Jeez, oh,
Are you allergic to bees?
No, just
I'm afraid,
cats.
I believe.
Oh, gotcha.
Ooh, that's actually kind of a deal.
Doc, I don't think my legs are meant to bend this way.
Because I've also been tasked with getting those, so I may need
That poor man.
Alright, just gonna feel some pressure. but no
Alright, here
pain.
you go. This should help it feel a little better and hopefully take that swelling down a bit.
Damn it.
Beat you to it.
Alrighty, how's that feeling for you, hun?
Alright.
That's better.
Let's get you wrapped up and get you shipped on out of
Sounds
here.
good.
Thank you.
Of course.
Thank God the doctors are getting strapped up these days, though.
Hi, how you feeling?
You know, like I can't feel my legs, like they've been ran over many times.
Alright. If you can't feel your legs, I'm gonna do just a little quick check here. Because I need to make sure you don't have any spinal damage going on, okay? Even though you did
Oh,
walk in here.
I think I got spinal damage, concussion.
Oh.
I think it was the guy was brutal. He wouldn't stop.
Mm-hmm.
I pleaded for my life. He kept going, kept running me over. Ow.
Okay, so you do
Yeah.
have feeling in your legs. That's good. I'm happy about that.
When I came in here, I was like,
I'm not that hurt.
And then I started
Yeah.
tracking his ass.
You said you didn't have any
Yeah, so
feelings, so I was
stupid,
gonna
bro.
make sure. Because the
you
spinal
didn't have to hit me
surgery
that
is
hard.
very
First
intense.
reverse.
It literally looks exactly like.
Alright, it does look like you have some pretty heavy bruising
Yeah,
here,
Oscar
though.
has
Let
an
me
eye
get that
patch,
taken
doesn't he?
care of for you.
You check to see how much blood I've got left. I was bleeding for 6 hours earlier.
Oh, Jesus. Yeah, I can do a quick little check. If you're feeling real low, we can get you a little transfusion while you're here.
Just like a to-go cup, or like a little sippy cup of blood or something.
Are you a vampire?
Yeah. Well, you know.
Yeah.
Get it however you can.
Fair enough, okay.
Dr. Payne's gonna roof 10-7 for a couple minutes.
10-4.
Well, I almost wrongfully kidnapped a man today.
You mean you almost wrongfully kidnapped me before? Yes.
When?
We don't make it a habit of kidnapping people, I
3
promise.
minutes ago.
I would hope
That
not.
wasn't you. Wait, what?
You're so dumb.
You've never seen a man in drag before?
Okay, now this is.
I'm fucking
Alright, I don't think your blood level's low enough to need a transfusion.
Yay.
Yeah. I think you're doing alrighty.
I'm alive.
He's
I'm
alive.
unkidnappable. I don't look like his husband.
Thanks, Doc.
Yeah, no worries. Oops, sorry. Oh my god, hello.
Hello. I flew out of my car and my chest kind of hurts.
Gotcha, okay.
What a loser.
Let's take a quick little ultrasound. We'll
You're
just
the
make sure
idiot who
nothing's
thought my
brokey.
fiance was here in the hospital and started dragging him out.
Wait, look at me.
True.
Yeah. Yeah, you got a point.
Did you always have this scar on your mouth?
Alrighty, I'm not seeing anything bad internally. You've not got any cracked ribs, no internal bleeding. You probably just got a pretty good bruise to this chest here, so let's get that worked on, okay?
It looks like a... I don't know.
Out of curiosity, is your fiance or no, your husband, right? Dr. like Oscar
Pep-
Pepper?
Peppered, yeah.
Gotcha, okay.
Maybe.
I was trying to think what doctor looks similar to Theo?
Dr. Payne and
Yeah, it's
Dr. Fera,
Oscar.
do you guys know what
It
we
was funny because I came in
can
here and I was
sell
like,
out of
"You,"
the
and then I dragged this ass out.
store regarding new stock?
I mean, I'm not feeling
Um,
like totally
I'm sorry,
good,
10-9 that
but
question?
I'm not bleeding or anything. I could probably do
The
with a
new
little
stock in
ice
the
pack
store,
rub down.
can we sell them?
Yeah, anything in the pharmacy you should be able to sell.
Rhea, do you need medical
Provided we have the
attention?
materials to, make it.
Okay.
Look.
He wants a saline syringe
What
for the
about
veins.
the new Doctor plushies?
Those are perfectly okay to sell.
Can someone sell them to me?
Walker's fucking everybody up.
Yeah, I can in just a sec once I finish with patients. Here you go, hun. How's that feeling for you?
It feels way better. Thank you so much.
Yeah, of course.
Get up.
I'm here. I'm here.
The dog in the hospital.
That's funny. KB or something.
And they're back. Sup, bro?
Oh, what's going
Okay,
on? What's
well,
going on?
there's no in there, so
What's going on?
Okay, so, what were you wanting to sell or be sold or...
The little helmets, because gravity is the enemy of the Reapers, and I thought it'd be funny
Oh.
to give them to
Let
everybody.
me see if I found
Okay, sure. How many were you wanting? And let me double check what the pricing is. One sec.
$7? For now?
7, gotcha. Are you okay with them being... I think we sell them for 200 per, is that okay?
It's fine.
Okay.
I
So
got given
7
one as
little
well as the frequent
helmets.
flyer ones because I'm here too much. And I was slightly offended, but I also thought that was funny, so.
Alright, I've got those little helmets working for you.
Nice, nice. You're good.
Could I get your state ID?
11605. You made the dog go splat? Oh.
There you go.
Thank you. It's probably fine.
Yeah, of course.
Yeah, I don't blame them.
Yeah.
That's funny.
Yeah.
I want to bring him down to the crypt so bad. That'd be so funny.
Yeah.
Dang it, I left my drugs at
Although
home.
he might terrorize the cats.
True. True. You could hear him screaming from inside.
Yeah.
Yeah, he hollers.
Mm-hmm.
Yeah, be careful of that dog. He'll
Good.
laugh in Spanish at you.
True.
Oh.
My gun.
He came
Hey,
into the surgery
doctors
once
from
and just
PD.
laughed at me.
Send it.
bit
Hey,
bullets out of my
we
leg
have one
last time.
Connor O'Leary requesting a trial by
Yeah, you
combat.
tried to do CPR
Would
on
you
me.
be willing to
That was impressive.
not only provide medical support but
I mean, that's why I
entertain the
assume he was
fight to be
jumping.
on top of EMT's roof?
Yeah, I guess so.
Honestly, that sounds fun as hell. As shift lead, I approve it.
10-4
What are they
over
doing?
76 to EMT.
Trial by combat on
Thank
the
you,
roof,
guys.
Smile.
Oh shit.
Yeah, no worries.
Ooh.
That'll end well, surely.
At least they're doing it in a place where medical is readily available, I guess.
True.
Fair.
Very
That's
true.
the one plus.
Oh look,
I
it's
wonder
fish.
who he's.
Oh my
Wonder
god,
where
it's
he came
fish!
from.
Oh, it's fish.
Oh my god. No boy!
Alrighty, we've got your helmets ready.
Hi, fish.
Why is he just staring?
He's just standing there, menacing.
Menacingly.
Alright, that
Okay,
should be
can
all
you
7.
hold that last one, actually?
Oh, hi,
Yeah,
fish.
of course.
Alex, can you grab that last one? It's for you anyway. Oh, sorry, fish.
Sure.
Sorry, fish.
You're gonna need it.
There you go. One helmet.
Okay.
So cute.
There you go.
Got it?
Yeah, it is really cute.
Alright, thank you so much. Appreciate it.
Alright,
Yeah,
wait, did
no
we end
worries.
up getting the medkits?
Oh,
Oh,
I forgot
no.
about those. Nope.
How many are you wanting? And
Just-
are you wanting the standard ones, or are you wanting like our specialty band-aids and things?
5 standard ones.
Gotcha.
Yeah.
Hana, if you're okay to charge, I'll go grab those medkits.
Yeah, Dr. Speedy.
What are you doing?
Send it.
2 questions. One, are you okay if we have some like lost MC members watch Connor fight? We'll like search them and ID them all.
Yeah, so long as they're not bringing any weapons or anything up, I'm fine with it.
Yeah, I let them know not to. Okay, and then 2 is Eleanor? Is she still in surgery? Is she okay?
Yeah, thank you so much.
Who is asking?
Jason Park.
Give me one check to check her ECs, and then I can text you. I can't say over radio for privacy reasons.
10-4, thank you.
Nope, he is not.
He's not?
He is not.
Okay, then he will not know.
Okay. Can you sell me a trinket bag as well as the new
The 2 doctor plushies?
yeah, the new ones.
Okay, are you wanting the Sama box, or are you wanting the serial
Kendall.
healers one?
Sama box.
Okay, the Sama box, just make it for free. Or I'll make it for you.
Dr. Kelly and Dr. Bean.
Mm-hmm. The Sama box you can make and keep like suckers and things in your locker to hand out to patients.
Ooh.
Alright, I've got those plushies making.
19315.
You can just grab them from in here whenever you want to, okay? Before the PD get here, I need to eat. I'm so hungry. There
In
we go.
loving memory of our fallen angel.
Yep. She was a good one.
ERP queen.
Are the rest of y'all going to bed? Oh, okay. So I think I might watch this trial by combat. Yes, I do need roof.
Yeah. I'm
Alright.
okay with it, just so long as you don't have any, like, weapons or anything on you, okay?
What if I promise not to use them?
I would politely ask you go put them away for safety's sake.
Where am I gonna put them away?
I thought you might have a car, I'll be honest with you.
I brought a bike.
Okay.
There's dumpster, but
No, I don't want you to have to put it in a dumpster.
Yeah.
do you promise to behave?
I'm gonna put my
Yes,
trust
I
in
promise
you.
to behave.
Okay.
Are you
Right.
sure?
Oh, well, there's a fish again.
Yeah.
Yes, I promise to behave.
Alright.
Especially because there's a roof. Roof is more gravity. Gravity's the enemy. I'm not gonna fuck with gravity.
Very true.
Did Theo go off duty? No? Where is he? Might be having a dispatch glitch.
Could make a state announcement and say it's on the roof, and then you have to find your own way up to the roof.
More people for me to treat.
Best seats in the house.
If you can somehow find a way to, well, I guess they could climb up there and then watch with binoculars.
Wait, is there a place that sells binoculars?
I think the
I think our
EMS here
EMS does.
but we don't have any on duty except for fish,
interesting.
so...
Oh. Camera works.
I just realized something. If perro is dog in Spanish, does that mean it's the dog beach?
Maybe.
Del Perro Beach. Oh, well, that makes sense
Beach
with
of
all
dog?
the equipment down.
Maybe.
Like a dog park. Dog beach.
Dog beach.
Oh, Indy, come here for a second.
It means beach of the dog.
What's up?
Didn't want to talk around people.
Yeah.
Kira?
Mm-hmm. Yeah, I noticed you were working with her.
Yeah, is gonna need reconstruction in her mouth.
Okay.
But she's got an infection, so that's gotta heal first.
Mm-hmm.
But I told her to once the infection's cured, to come find you or me if it's around this time.
Yeah, that'll be fine.
Yeah.
I know the infection was bad enough she lost some teeth. What we'll probably have to do is put some false teeth in and then basically kind of restructure that bone so they'll be held in place.
Yep. I know you like bone stuff, so.
I do. I do like bone things.
Yep.
I actually got to use the other side of my ortho specialty today.
Oh yeah?
Muscle tear.
Nice.
Had to suture that up. Or actually, technically Hana did it, but I walked her through it.
Oh yeah.
Yep. People forget ortho isn't just bones, it's bones and muscle.
Yeah.
Which is why I also do PT. Smile.
Yep. I
As
just
if you've-
wanted to let you know.
Well, I appreciate you keeping me in the loop. But yeah,
Mhm.
I'm down. We can always schedule out a surgery and maybe just have it be you and me, primary, secondary, and get her done.
Yeah, that's what I was thinking.
Yeah, I'm down for that. That's fine with me.
Yeah, because I told her, I was like, you know, if it's around this time, then it's probably gonna be me or Indy or both.
Yep. Yeah, unless she comes around way earlier, then it could potentially be Ember.
Yep.
Dr. Farah, that report's done, by the way.
Sounds good. I'll give it a look over.
What's this trial by combat about?
Apparently Connor O'Leary wants to fistfight someone in the PD, so they're doing a trial by combat instead of
Oh,
like a bench
okay.
trial.
Oh,
And they requested medical either be present, or they said we can do it on the Eclipse roof if you're okay with it, and I said sure.
hell yeah.
Yep. Because I'm the highest on duty, I can approve it.
Hell yeah.
Yep. And they said, is it okay if some Lost members come? And I said, as long as they don't have weapons and they don't have masks, I'm okay with it.
Yep.
And if they cause bullshit, I'll pull a gun and shoot them and then take them downstairs and treat them.
Well, I
Smile.
may need help getting up here, so.
Yeah. I'm waiting for the PD to radio.
But yeah, just didn't want to put patients' medical information around everybody, so.
Yeah, I appreciate it.
Mhm.
Also, if Jason Park asks you about Eleanor's surgery,
Mhm.
he's not one of her ECs, so just tell him you're not one of the ECs, I can't tell you.
Okay.
Yep, because I'm sure you heard it over radio, he tried to be like, oh, how's Eleanor doing? I was like, let me check and make sure you're one of her ECs, dude. And then I'm not going to tell you over public radio when there's people on this radio that are not her ECs.
Yep.
Dr. Speedy, they've all been searched. We're gonna start bringing them upstairs.
10-4.
All right.
Go up to the hospital roof as a courtroom for, the foreseeable future of this trial by combat.
Oh, it'd be so cool if like the helicopter wasn't there and they could fight up there.
Theoretically speaking, I could give myself a pilot's license and move it, but
No.
Is that cool?
Can you give me a pilot's license so I can move it?
Nor.
no.
Damn it.
I don't want to have to pay for Life Flight 1 if it gets damaged. Because I'm the highest on duty right now. I don't have Life Flight 1 money.
No one
How
has
much do you guys have to
Lifeline
pay for
money.
that?
I don't think even the hospital has Lifeline one money.
Yeah, exactly.
Technically, it says
Yeah.
fire department, so it's fire department money.
True.
I think the fire
Terry
department
has to
have
pay for
less
it.
money than the hospital.
Oh no. But can anyone get on the roof?
No.
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 But they could unlock the lift.
We
Oh, I'm
could.
just
I think they're
checking.
carrying them up, aren't they?
Yeah, they're carrying them up one by one.
That's the cop that's gonna fight.
Who the fuck is
what
that?
cop is that? Who the fuck is that?
Hello.
Who knows?
Oscar Bomber
Hello.
or something.
Hello. We should be
Everyone's
picking
here
up
for
any
trial by
moment now.
combat,
I was
Oh, yeah.
here to
Nothing
get
else happening.
help, and then they said trial by combat, and I said yes.
Oh, do you still need help?
Is
No,
it
I'm
Louis
good,
still
I got
coming
you.
up here?
I don't know. Yes, Simon.
Yeah, I was gonna
Okay.
go to
Simon-
bed
Simon
like
said he was coming
90
up here,
minutes
but-
ago, and then
Yeah, you said that.
What's his name? Park? Jason Park?
kept on
What the fuck his
getting
name is?
Yeah.
He said that
Fucking
like,
Midwestern
they're about to bring
goodbye,
him up,
didn't you?
like Connor, so I don't know.
Yeah, I did, didn't I?
Yeah. It's like you say goodbye, and
Fucking
the
hell.
30 minutes are still there.
Damn,
Yeah,
that dude hairy as fuck.
So why are you dressed kind of fancy?
Is that a tattoo or is that hair?
it was just
Let me
something
see.
I had to get changed into.
Dr. Speedy.
Send it.
Oh, that's hair.
Sorry,
girl.
can
That's
someone
hair.
unlock the elevator?
was a
Fucking
tribal
Connor's
tattoo.
heavy ass.
Got
We
it.
can't carry Connor's big ass up this thing.
We're working on it. Give us just a couple seconds.
Thank you.
I think it's unlocked.
Give that a go. This will lock it right after it gets back up.
When I brought it up, it says it was unlocked, but
He's the option for underground parking. We're coming up now, thank you.
No worries. There we go.
Thank you.
all right.
I got it. Should be good. Yep, so they can get back down to the main floor, but not to the morgue.
Cool.
All of the lower levels. That way, you guys don't accidentally hit
I
us
need
on the
icy
upper
pack
level.
for Boo Boo.
Oh, I gotcha.
Yeah, that's probably the smart way about it.
Did any of you
There
guys,
you go.
doctors, know Al Hart and not go to the Al Hart day?
Unfortunately, he was around before I got hired, so I never had
Okay.
the opportunity to get to know him.
I just have like extra bears, so I just want to make sure if people who knew him didn't get a bear, I have bears.
Gotcha.
All right, ladies, are we doing best of 3 for this?
I love my bear. I'm okay with whatever.
Oscar,
let's
best
see.
of 3.
I
many
love my
charges?
transfer that Axel got me.
Best of 3.
Best of 3 sounds good to me.
Best of 3
That is
between
a-
you two.
that is
Okay,
a
we're getting
hairy
one more
man.
person up here, and then we can begin the rounds. All right.
I thought
Bear
Roger
chest.
was hairy,
Whoa,
but
bear
no,
chest, gentlemen.
that is
Take
hair.
the hats off. Take the hats off.
Connor has fucking saggy pants.
Watch out with these
First
cross
off,
stats. There better not be anything crazy.
Connor, come forward real quick in front of the staircase.
Yes, my liege.
Mr. O'Leary, you're being charged with assault and battery ×2, resisting arrest ×1, felony trespassing ×1, criminal possession of a handgun ×1, criminal threats ×1, and petty larceny ×1. How do you plead?
Fuck the police.
That's not an answer.
Not guilty.
Okay. And you are requesting trial by combat, is that correct?
Goddamn right.
There's a trial by combat on the top of EMT. if you
All
wanna come
right.
watch.
Case. My name is Justice Parker Huang. I am sanctioning this trial by combat today. If anyone has any objections, please say so now.
10-4, they were-
Yippee! I love Parker. Yippee!
Someone let this man know the rules.
We'll get there.
Oh, okay. Wait, if I win?
Sit down.
Okay, dumb question.
Oh god.
If I win, do I get my gun back?
No, you
Oh
don't.
no.
That would be illegal.
Everything I do is illegal. I walk, I get arrested.
You miss every shot you
Pretty
don't
much.
take.
Listen,
Cops
you
just
had
hate me.
that shit. Okay.
You get a decent exposure for those pants.
Right, girl.
Okay. Okay. Listen, I grabbed the pants I can't use a belt with because I can't use a belt, okay?
You don't know how to put it on? Is that what you mean to say? You don't know how to put on a belt?
I
He has
only have
one
one
arm,
that,
Mira.
yeah.
So, how does that stop you from putting on a belt?
Maybe he has a Velcro belt, you know.
Well,
I don't have
Meredith
those.
did pick out special pants for him, but he doesn't wear them all the time.
Yeah,
Gotta-
I just wear.
Oh,
I
the
just-
special pants.
Really wish I
special
could eat
pants.
some
His
popcorn
big
right
boy
now.
pants.
Yeah, the one with like the stretch waist thing.
The ones that have a butt flap on them.
What?
No, those are PJs.
Who said that?
I did.
Oh
Yeah, like big onesies you can get.
Oh my god.
Come on.
Alright.
Also,
Hey, no pre-game into your punches, pal.
I'm gonna shave that
Officer Park,
chest.
can you put
Leave
this
your
in the next
knuckles
trials
to me.
request
You
as
get his
well, so I
back
can
while
just
you're at
accept
it.
it?
Right.
Sure.
Can you fucking
Thank
shave him or something?
Alright, go.
Wait, hold on.
I almost forgot about that because you called me directly about it.
Hell's your problem? Why do you nearly throw up over my shoulder?
Because your back is hairier than my mom's ass.
Yeah,
How do
your
you know
mom
how
got a
hairy your
hairy
mom's
ass.
ass is? Yeah.
Wow.
Yeah, that's a
not,
very.
not Nicole.
That's
not
really
Nicole.
specific.
Oh,
Not
That's-
okay, yeah, not Nicole, not
That's a
Nicole.
lot.
So all my mom cared about was crack.
Apparently, if she had a hairy ass.
I miss crack. I miss it.
You want some crack?
Should be
Okay.
We both know there ain't no crack. That implies that you have crack to mix with the cocaine.
All right.
Oh.
Is this all the spectators that we're getting today?
Believe so.
I think so.
No one else is coming?
No.
All right, welcome everybody. We got trial by combat today. On our left is Officer Oscar Kingston Balmer. Is that correct? Did I get that right? All right, and on our right we've got Connor O'Leary, who apparently has won what the
Every
fight
single
night
fight,
every
almost.
night. Oh, okay, every single fight almost. We'll just put it that way. Here are the rules: no weapons, bare fist only, wrapped or traditionally just bare fist. No lethal blows to the vital areas. None of that nonsense. The victory conditions are: one of you yields, one of you becomes incapacitated, in which the doctors will, I'm sure, happily take care of your boo-boos. Thank you, doctors. Or if it goes on extremely long and I decide to declare a winner by whoever I deem more dominant.
More dominant.
All right. Any outside interference will void that particular fight. There will be no cheating, no weapons, no poison, no, below the belt
punching.
shots.
Don't throw people off the roof.
Fuck.
Also, if anyone, does any cheating or does any interference, you may get voted off the platform and then potentially thrown off the roof. At which
Ooh.
time, since
Oh,
it
throw
is the
them.
hospital, it is the best place for that to happen, and I'm sure the doctors will probably save you by the grace of Eclipse Medical.
If not, RIP.
Medicine.
Well, you fafoed. I don't know, just put it that way.
I call dibs on throwing him off the roof.
Girl.
No, I'm pretty sure I'll have one of the doctors do it because they're professionals at,
Yeah, but it's murder charge.
saving lives.
Oh
Murder charge.
my god.
Let an already established criminal get the murder charge. It's fine.
Anyway, this trial by combat is, effectively public, I suppose, to an extent. Spectators are allowed, but none of you can interfere. Interference will earn you a contempt charge. Cheating will also earn you a contempt charge. That may come in various forms, such as fines or jail time.
Ooh.
Is cheering and jeering allowed, or?
Yeah, I think you could do that. I think that's kind of par for the course of a fight.
What was that?
They said you can nipple twist.
Connor, are you
Grab
know
his
what? You
dick
bring-
and
you bring-
twist it.
You bring that up every single time, Connor.
Oh
Are you
my
into
God.
nipple twisting? Like,
Yes.
All right, the
Oh.
grundle is a no-go.
okay.
All right.
All right. So please raise your left hands for me, both of you. Do you swear by the oath that with your bare hands you shall also bear your truths? Do you swear that your blood, your bone, and your sweat shall be laid bare today in front of all these spectators, that your causes are just and that your grievances are true? Will you
I swear.
follow the law of the fist fight and trial by combat today?
I do.
Yes, I will.
All right. Let's get it on. I'm going to do a countdown. You guys can start when you're ready. This is going to be best of 3 since you have a lot of charges, and, sometimes the first fight don't go that well for everyone. So.
Yep.
On a count of 3. And I'm going to count down, not up, so. On 3, 2, 1, fight. Ooh, and Connor gets
Connor
the
with
first hit.
Ooh.
Oscar,
Nice.
don't look back.
Miss. Oh, and Oscar got one. Oh, and he
Oh
almost
my
got
goodness.
down
Staggered
already.
him.
Knock him down.
Oh, and
Up
he
against
goes
the
in
wall.
for a punch and a 1-2. Another clean hit from Connor. Oof. Officer not doing too good.
Shit.
No, he is
Oh,
hit.
damn.
Good shit, Connor.
It's all right,
1-0
buddy.
for Connor. And then the doctors are coming in to help the officer.
Let's go,
there.
doctors.
Thank you, doctors, for allowing this for the hospital roof.
You know what?
That did not look pleasant.
I'm feeling crazy.
Connor.
Give me 2 at once.
Oh,
Shoot.
God.
What?
Oh my god.
Want to get tag teamed?
Double check
I knew it.
bandages or tighten everything, everybody.
I did.
All
Well, I
right.
mean, he is in a nipple twisting, so I mean, are we shocked?
Yeah,
Are we?
right.
Are we shocked?
I mean, look,
Girl.
he's choosing that, and his time in jail is at risk. So
I'm too cooked for this. I'm laughing at everything, y'all. I'm so cooked.
Now you know. Now you know. Lock it in, bucko.
Need some band-aids.
I'm good.
Okay.
are both sides ready?
Ready.
Both sides feeling good?
You're ready.
Feeling great.
All right. On my count. 3, 2, 1, fight. Ooh, another clean hit. Started off. Ooh, an exchange of blows right there. Connor goes in for another hit and gets pushed away.
They're close to the roof. I mean,
They're getting close to the edge there. That's
Move it back, move it back.
That might be a little TKO there if someone gets off the roof.
Oh!
Ooh, that was a
Acquitted of all
nasty hit.
charges.
You hate to see.
Hey, you're gonna get a tag where they just don't let you do that anymore.
Yeah.
You know, you're still not getting your gun back, and you still had that shit, so you're not really acquitted necessarily.
Oh.
Well, he's not being charged with this, so period.
No, he's not getting charged, but you know, we know you did it. You know you had it.
Oh, I fucking did it.
Nice. Jesus.
I mean, there's plenty of people here if you want to keep going. Oh no, I think we may have lost the officer.
Oh
no.
Oh no.
Murder. I got it.
Is he okay?
Witchcraft.
I didn't do it.
I killed
Did
him.
he slip through the vent?
Rest in peace.
Witchcraft.
vent?
Witchcraft. She did it.
Well,
just a doctor being like, it wasn't me. I didn't do it.
You can't sue me for malpractice.
You know, if there were more officers, I'd go longer. But there aren't that many officers that wanted to fight.
I mean,
But we also may have lost an officer to the vent.
if you want double or nothing, all or nothing.
I mean, I got nothing to lose. I'm only banging your girlfriend.
Okay,
Oh,
bucko.
I missed.
He ain't even
You know what?
mine
Beat his
anymore,
ass,
man.
Park.
You can do
Beat
your
his
own
fucking
thing,
ass.
bro.
Girlfriend. Wait, who's Park's girlfriend?
What's the tea?
Listen, man,
Rip
you
that
can leave her
resident.
out of this
Anyway,
one, alright?
Which one?
Wait,
Penelope.
Which one?
What?
Penelope.
We're doing this through the eyes.
Oh,
far.
Gaspar?
Gonna run
The-
back
I always
and
do it
forth
through the
sometimes.
eyes.
Is she here?
Through the eyes.
I don't think so.
I mean, you
Oh,
can
damn.
you can do without the eyes. I'm fine.
Hana, you all good?
No. Let's not do it through the eyes.
Okay, fine.
Can I get touch up? Can I get ice pack first?
Did we recover the officer?
Yeah, he's being tended to by Nancy. It seems his blip is having some issues locating his
Oh.
blip. Yeah.
Do I need to go down and get him?
Yes.
Oh.
No,
there
I
he is.
think
Oh,
there he is.
there we
Someone's grabbing
go.
him. There he is.
I'm actually not. I'm just fucking with him. It's fun.
So embarrassed at his
What?
loss that he had to vent.
I said I'm actually not doing it. I'm just fucking with him.
Well, Connor's truly showing why he's a Fight Night champion.
Yeah.
You and Kim are fucking?
Listen, you go. Does she know that?
Yeah, does she know that?
Yeah. We're not fucking. Like, we haven't done anything.
Are y'all dating?
He's courting her.
We're
Court.
We're in the works of it.
Okay. Oh, so that's what y'all two
Who's
were doing
the
whenever.
one that you were?
whenever we
Who's the
saw
one you were
you.
interested in, Louis?
Alright, Connor.
Back in the day?
I mean,
Was it Kim?
no.
No. Okay.
Not sure.
Oh, Louis has morning voice.
I know Louis trying to court
let me-
Tiffany very early on.
Oh, it was Tiffany? Okay.
Let me hear that morning voice.
He was trying to court Tiffany, but like.
Well, I
Tiffany-
remember we were working Bahama Mama's one night, and I just see him carrying her into the private room.
Yes. So I told her you're single. and she said, I'm good.
You're missing Louis' morning voice.
I'm ready.
All right.
Oh, okay. Have fun. We're watching Connor do trial by combat.
Your Honor.
Yes.
We're
Yup.
ready to go. We're ready to fight.
All right. This
That's
is best
Okay.
of 3 round 2.
He fought one cop. I don't remember his name, Oscar, and now he's fighting another cop named Park.
On our left is Officer Jason
Okay.
Park, and once again
have
on our
fun.
right is Connor O'Leary.
Fine.
This isn't actually for the charges, or suppose I could put that back on the table just because, funny. I'm kidding.
Well, jump off this roof.
This one's different. Keep saying her name. Talk about her, man.
Penelope.
All right, so this seems like an actual
up.
dispute between both of you, so I'm gonna swear you in again. And I wing these swearing ins, so both of you raise your left hand and face me. All right. Both of you are called here to resolve this dispute, not by words, but by trial by the ring of law. Raise your right hand and hear the well, I guess your left hand. Do you swear before this court and its officers that your claim is just and your grievance be true, and that you come here to this trial not in vengeance, but in good faith for your final judgment between both of you? Do you swear to fight with bare hands and clean intent, without trickery, weapon, or outside aid, and to accept the outcome of this trial, whether it's victory or defeat, as binding and lawful under the code of this court? If you swear, answer now, I do.
I do.
I do.
All right. Both of you ready?
I'm ready.
All right, on my count. 3, 2, 1, fight. Ooh.
Oh shit.
Go 1, 2,
No.
3. He tries to go for the kick. Ooh, right in the back of the head. He went flying
He's
there,
still up,
but he's
though.
not down. Oh, well,
Oh
I
my
guess.
goodness.
Jeez.
That was nearly.
That was a rough one.
That was ooh.
Wow.
That was nearly.
Well,
He said, "Tell Penelope I said hi."
I don't think anyone saw that one coming, but we've got 2 more fights.
Fuck, I'm on my phone. I'd read receipts off right now.
Damn.
Yeah.
You're gonna have to wait for that one.
Yeah, so I'll let him wallow in his misery.
Okay.
Are both of you feeling okay?
He
Can
barely
you?
laid a dent in me.
All right, doctors, you okay with them continuing?
Connor seems fine, yeah.
All right, I got you.
Okay.
Oh, you want to go for the eyes now? Okay.
No, I'm good.
Okay.
All right. If you're ready on my count. 3, 2, 1, fight. Or don't.
Oh.
Okay.
That's,
Wait.
oh, there they go. All right. Ooh, and a 1 and a 2 and a 3
Oh.
and a
Oh
4.
my
Oh my
goodness.
goodness.
Come on. Punch me. You know you want to do it.
Okay.
All right. Well,
Oh wow. What the fuck? That was so. Park. Come on, girl. What was
I maybe that first fight kind of knocked it out of him, and he's just delirious.
that? Probably.
Do you have a concussion?
He said, hit me.
You okay,
He said,
Park?
hit me. You won't. And then like what was that? So,
Right. I suppose I declare the winner as Connor O'Leary in these two fights. Not sure how I feel about that last one though, because that really felt like just a I wanted to
Bully?
be punished
Oh.
moment for something.
There we
I
go.
feel like I feel like that last one should get canceled out. I'm not
You
gonna
get this time,
Yes.
Connor.
Not gonna
What
lie.
can get it this
Is
time?
you busy
Are we
right
going
now?
again? Is that last one does not count because it just seemed like he just wanted
Sure,
it?
it's just another
What's
chance
up?
to bully
Technically.
them.
You want
No, I was just saying we're doing the hanky
You want
panky
to spice
outside.
things up a little bit?
Park's
You
a
want to
little
spice things up
delirious.
a little tiny bit?
Ow.
Do it up there.
Oh my god.
It was
No,
just,
that-
you
that
know,
just sounds like a
nobody was
fucking
inside,
disaster.
so we just started doing the hanky
Not
panky
all
outside.
the way up there, just up like there, that little bit.
I
It's,
don't
it's
think you
like
know
it's
what
not
hanky
bad.
panky
the
means.
first time that they fought each other.
I was
he
told
was
that, what?
fine.
Isn't that the dance?
Be fine, probably. You
Did
got
Fane tell you that?
concerns for this place, right?
Or
Oh,
did Santi?
Santi.
I
Okay.
don't think that counts.
Well, congratulations on doing the hanky panky. I'm very proud of
So they
you.
did swear in front of a lot
Yippee,
of
we're all
witnesses.
hanky pankying outside.
Yeah, I'll come down in a little bit.
Yay, are we all hanky pankying?
We still have thoughts about her daily? Like,
I mean, maybe.
Hey, you can just throw it away. Yeah. We've got like a shit ton of stuff to.
I mean, you should tell that to her.
Yeah. All right.
She hasn't moved
Bye.
on.
All right.
Feel a
Can
judging
you both hear
presence
me?
over me.
From over there.
mm-hmm.
All right. Are you both ready?
Oh
I'm
yeah.
ready.
Give it to me.
Okay. On a count of three. 3, 2, 1, fight. Well, this one might be a little more even this time. We don't know yet. Oh, and going for the crazy punching today.
Nope.
I have to play that game.
Oh.
Too. Yeah, like crazy punching.
Oh.
No
Ooh.
way.
You know, at least no one flew off the roof.
True.
Hold on. Yeah. Maybe next time.
No, Connor.
Wait,
God.
no,
Oh
no,
God,
no, holding
Oh,
on.
okay.
Oh god.
Oh
He
my
literally
God.
wins all his fights and then.
And then does stupid shit.
Connor.
Oh no. Oh no.
Oh my God. Oh.
Don't do it,
Do I
Mr.
look-
O'Leary.
Oh my God.
Uh-oh. Oh no.
Oh, he's got the taser.
Oh no.
Just stay clear.
That could be even more dangerous.
Can I have an aspect?
I got it.
I know. There's tasers out and things. I just don't want you getting sideswiped, okay?
Oh, that was me.
Thank you.
On
To go
the
down the
roof.
bottom.
Did you get it?
I will blacklist you from trial by combat if you do nonsense like that.
Thank you.
How you doing, bud?
Who's spicy?
Yeah, good old Sonny Los Santos.
Yeah, you will literally get that tag that you're not allowed to do this shit anymore.
Are you feeling better?
Just take it as long as you can get it, you know? Like, don't rush it now.
Oh, can I get a band-aid, please? Oh.
Yeah, I got you. Here you go. Do you have any severe bruising or anything you want me to look at?
Simon, what'd you think of the picture?
Good.
Surprisingly, no.
Yeah, you're looking good.
Thank you.
Only
Yeah,
part
no
that's
worries.
bad about it is me.
What do you mean it's you?
You look good.
You look
Nah,
good.
It is
well.
not that bad.
Oh yeah, no, Tiffany's away.
Not
Do
bad.
I need to add myself to the bench?
Hello, Alex.
Hello.
Like, she'll go for a little bit, but I don't know if she's gonna stay awake.
San Andreas, right
I'm
here.
gonna go off duty. You guys have fun.
Alright, take care.
Yeah.
Alright, so now we have to get down.
The elevator, silly goose.
You should have access
yeah.
to the main floor from up here. You should be
Oh,
all good.
shit.
Are we good to go or?
That's up to the justice. I'm not
I
sure.
think we are.
Connor, you
Oh, yeah, no,
probably
yeah,
wait
we gotta,
till Parker
yeah, we
says
gotta,
you
yeah,
can
we
go.
gotta wait for Parker, yeah.
Oh, right.
And after that, they may try and.
They're probably gonna try and push something right now.
Yeah.
Maybe if they do.
I tried.
You do lessons?
Learn a little bit better. Get a little bit better.
Yeah.
If they
I do.
Shift 3 is where I usually do funny court. So
our favorite kind of court.
They charge 5K.
We like it, Judge.
Yep.
yeah, it's just
the
no one ever
value
asked for
lesson.
funny court. Always serious court.
Eh, true.
Number, but I don't have a phone.
At least it's something.
All right. Well, you can get your stuff from the cooler up there.
Tomorrow, we're all gonna be wearing PJs because that shit gonna go on forever.
My PJs is boxers.
I mean, I could do pajama court, but that doesn't. You know.
Good Good fight. Good fight.
Good fight. Good fight.
Now if we could get, throwable pillows, that'd be great. We'd have a pillow fight.
My
yeah.
PJs are boxers though. Can I
Body
shop for
pillows.
boxers?
As long as your dick ain't poking out.
Well, I do own the
can't
body
shop
pillow
for those.
company.
I don't.
Smile,
Coffee.
Vera.
Coffee.
Well,
Coffee. Girl.
You should give
Hey,
a
I'm gonna go
complimentary
find my
diamond
shirt. I
ring.
think I left it in the
Pills.
bathroom.
Hello.
Hey,
Hey.
Hey, what's up?
listen. I don't know where you got the thoughts or whatever.
Hey.
Nothing personal. I move on in life.
I think Tito was
Today's
asking if he
tomorrow's
forgot
another
about
day.
a body pillow that he wanted
Make
or
greater and better memories. All right.
Oh yeah, Tito did want a body pillow a long time ago.
I don't know what
Yeah, he
you got
mentioned
that
that the
about.
other day because
I'm
he
moving on
realized
past
that I
this.
own
Get to your
Galaxy
stuff
now?
and get you out of here, you top thief.
Well, I mean,
Was
yeah.
I signed off on anything else today? Or?
Right.
No, I'm just confused.
Like,
I
hello?
haven't looked over your
Maybe
report.
talk
I
to-
know there's at least one or two things I
Right.
know I'm
There's
gonna
no
check
bad
you off
blood
on.
from this.
But when I
sorry, I'm
review,
really
I'll probably
confused.
check you off on more.
Percy that he could get a body
Just
pillow.
as I see what you've been treating.
It'd be
Let's
funny
get your
because
stuff.
then you could
Okay.
get some other
Yep.
Okay.
I feel I'm
I
so
appreciate the
close.
update, Spark.
Yeah, you are close.
It wouldn't be so bad.
You
And
guys
I've seen
should.
a really good
no,
You guys
update.
should be able to go down to the floor,
Let's go.
the ground floor.
Yep.
Yep.
Thank you, everyone.
No worries.
Thank you guys.
Appreciate y'all. Now I need to get
He's the fight night champ. I might have gotten him once in the water, but he's different on land, definitely.
Oh my goodness, I've got the burps.
See you guys around. Thank you. See you.
And bye.
Boy.
Ooh, the lobby. Whee.
That was fun.
Yeah. I was worried when he nearly threw him off the roof, and I was about to be like, okay, we're blacklisting this shit. But
All right,
thankfully
that's
the cops
locked.
didn't do that.
And that's locked.
Yep, should be all good.
How come the public floor is locked for me?
It was...
No, never mind.
I was about to say, I just checked and made sure
I'm
it was
dumb.
unlocked.
I'm dumb.
You're good, you're good.
I was in the lock elevator part, not the regular part.
But yeah, it could be a really good fundraiser. Charge like,
Yeah.
what, $250 per person that wants to be in a fight.
I have a document on my phone that's titled "The Doctor and EMS vs. PD Fight Night Ideas."
Oh yeah, I actually remember the night you stayed up making that because we were
Yeah.
in my house.
Yeah, controllable area prizes ? Healers versus the authority, bandages versus the batons.
I
Or
still
name
like
ideas.
I still like bandages versus batons.
Yeah.
I need to have Joey or something teach me how to fight.
Yeah, me too.
Because I mean, if I ever have a fight like with a PD member, it would be so funny to just beat their fucking ass instead of going to court. I hate court. Like sometimes it can be fun, but 99% of the time I'm just bored out of my wits. Hello.
Oh, hi.
Alrighty. For your surgical report, you are missing one very critical thing.
Hmm?
Yep, I'll go ahead and let you have a look over. You're missing something.
Oh.
That's alright, I'm not mad. I'm figuring you'll probably notice in a second and fix it.
Oh, I can see it already.
You're all good. Deep breath. Just go
Oh,
through
my
the proper...
tags.
There you go. We're missing tags. And then once you get done with the tags, I would like you to attach her previous report down at the bottom. Five 1998.
Like that? It was just the one, wasn't it? The ICU report?
Yeah, just the one ICU report. And then
And
I've gone
then-
ahead and attached this one to the ICU report. Perfect. Looks good. And I'm going to add a little note, basically just explaining why we're downgrading her from ICU to observation. And we will remove her from the ICU. Oh my god, it's the
Right.
cowboy gang.
Mask off. Damn it.
Damn it.
Okay, get in line again.
What happened to the shirt you were in?
Oh, this way, this way.
I don't know. I don't want to
I
talk
mean-
about it.
Oh,
Zoe, bitch, we
Jesus.
gotta move a little bit.
Oh no, you're fine. You're fine.
I mean, you still look very nice.
Masks off, please.
Thank you. Also, I don't condone this.
Oh.
Lord almighty. Alright.
Thank
Oh.
you.
So close to me.
Why did you
Move
tell
on.
me it was called the hanky
I can't. I'm in the middle.
Okay, okay.
I mean, it's funny as hell.
It's so funny. It's so funny.
Yeah.
All right. 3, 2, 1, go!
Thanks, I hate it.
This is so much idea. I just want.
Hey, thanks for all your hard work, beautiful.
Uh-huh. You know what's
I'm
funny?
just
I
gonna
just
keep
got...
staring at this nice wall.
Yeah, I just got down from the roof after approving a fight night.
Yeah, we
or
got
a
a trial by combat.
Ooh, hell
So
yeah.
this is unfortunately perfect timing.
Right, you're already into this.
That's not me. It's not
Oh my
me.
god, you're so into it.
No. No. No.
You know how when you have like little kids and they're like, Mom, Mom, come check out what I can do. And then they show you the
Yeah.
stupidest shit. This is exactly what this is.
Yeah.
Why? Actually, I know why they come here. It's because me and Jess are here. That's exactly
Yeah.
why. I just never thought.
Are they done?
Yes, just finished.
Uh, filthy animals. Filthy ant. Can you push me on it when I'm little?
This is a nice shirt. I might use this more often.
Yeah. I mean, I won't complain.
I'm holding on. I'm holding on. I'm holding on.
Okay, to get a room.
This is a room, a big old room.
Mm-hmm.
Ladies'
It's
orders.
occupied.
Wait, Indy, you didn't explain what Indy was.
A little weird through the mask, but I mean, if she insists.
If she insists.
Also, this room is soundproofed, but has hella big windows. This is where we do doctor interviews and stuff.
Mm.
Yeah.
I mean,
also-
there's water here anyways.
I mean, true. Water, a nice rug, 2 very nice couches. If we want to do it on a ratty couch, there is one on the roof.
I'd imagine it's very clean too.
The one on the roof? No.
No, I meant in here.
Oh, yeah, it's very clean in here. They also use it for psych appointments sometimes.
Oh yeah.
Yep.
Oh, speaking of which,
What's up?
Alex might need to crash at our place for a few days.
Alex Fing's girlfriend?
Yes, apparently they got called and threatened.
Okay, that's fine.
Oh, hold on. Speaking of it. Hey, Fang, what's up? So it's quite literally the one closest to the corner of
Lesbos Lane and Algonquin.
Lesbos Avenue. It has a really big front yard.
Big front yard, beehive in the front, yellow 1-story house.
Yeah. Yeah, I got you. All right, bye. I need to go unlock our door for them.
Okay. But yeah, there's bunk beds in there for a reason. Hi.
What the?
What's up? Hey, can we shoot up to my house like, real quick?
Yeah. I'm just gonna go check on some things. So I just need to get dropped off.
Okay. Works for me.
At Little Soul on my bike center stuff.
Yippee-ki-yay.
Wait, can you drop me off at Little Soul? I have to get my bike.
Okay.
Bye, y'all.
Bye.
I don't know what's got Silver hung up on doing themed nights, but yesterday they were British.
Oh?
Yep.
Oh, by the way,
Mm-hmm.
if Aurora the dog is around and Kira's around, try to keep them away from each other.
Okay, I heard a dog growling a shit ton earlier. I'm assuming that's what that was about.
Yup.
Okay.
As
duly
soon as the
noted.
dog saw Kira, it started just growling like mean, very mean.
Mm-hmm.
That's why I brought Kira back into the ICU to treat instead of in the
Instead
ER.
of ER, okay. Yeah, that's perfectly fine.
And I don't know
That's
what
odd.
happened, so
Well, I know who I heard with the dog, so I would have assumed they would have
yeah, it was the vets with the
wrangled it.
dog.
Yeah, exactly. That's odd, but
Anna
duly
Anna
noted.
did come and talk to Kira,
Mm-hmm.
so I don't know.
Did she talk in an apologetic way, or was she accusatory?
No, it was more like basically like kind of friendly.
Okay.
Like told her if she needed anything, Anna's in the city hall app, give her a call or text or whatever.
Gotcha. Okay.
So it was in a friendly way.
Okay, good. Because, I mean, the vets are going to be defensive of animals. I mean, it's literally their job. But, I don't
Yeah,
know.
but Kira did nothing to provoke it.
Yeah,
here.
exactly.
So it had to be something before.
Who knows? Maybe that dog has bad experiences with people with white hair, or, like, you never
Yeah, I
really
don't know.
know. Because, I mean, an animal can't really just tell you straight up what pisses them off.
Yeah.
Alright. But, duly noted.
Yeah, that's why when I was done treating Kira, I basically walked ahead and checked and made sure the dog wasn't around.
Mm-hmm.
Because she was truly scared, so.
Right. Right. It's wild that me and this hearing aid patient have just been missing each other constantly.
Mm-hmm.
I've been around for so long long for me. Because I think I clocked on around like 10-ish. So I've been around for coming up on 3.5 hours.
Nice.
To be honest, after I bought that bike, I know it shouldn't bother me, but seeing my bank account that low is like,
Yeah.
I don't know why it bothers me, but it does. So I'm like, I'm going to put in a couple more hours at the hospital than I usually do. But we shall see.
Yeah, I know. I brought pains down to the 30,000s.
Gasp.
I know.
I worked it for a while early yesterday. But I think they're just... I made the mistake of opening around the same time the casino had its soft opening. So there was nobody around.
Yeah.
I did make a couple sales though. But that was just mostly to PD folks. And one guy who was very pushy about me buying some honey from him. So I did, so I didn't get... They all had masks on and we're all in one car and we're like, yeah, bro, you should totally buy his honey, bro. And I was like, you know, to be fair, I negotiated it down from 50 jars to 10, so I think I did all right.
Oh my goodness.
Yep. Me thinking about my own beehive at home.
Yeah, you have a beehive at
I have
home.
a beehive at my house. I don't need to buy honey. And I told them that much and they were like, well, where's your beehive at, bro? And I was like, at my house. And they were like,
Oh,
yeah,
it was
it's
a
not.
bruh.
Yeah.
Okay.
Yeah,
bruh.
it was like,
Yeah.
and I was like, okay. Yeah, you're right. You know, it's not here and you have readily available honey, you know. Yeah. So anyway, there's honey in the trunk of Pains. I had to pay $15 a jar for it. Which pisses me off.
Oh my goodness.
So if we want to offer honey toppings for a little bit for, you know, $15 or whatever, we now have 10 jars of honey in the trunk of the food truck.
Okay.
But I didn't get jumped. So I count that a win.
Oh, nice.
Yep.
I might change the menu at some point.
Yeah.
Yeah.
You know what we should do and make people
What?
really mad? Bring the green apple spritz back, but replace the rhubarb spritz with it instead of the Negroni.
Oh my goodness.
That would make people so mad. But it would
It
be
would.
kind of funny. It'd be a little bit funny though. Just a
But
little
it's
bit
funny.
of a tee-hee.
It's funny because if I take the clean Negroni out,
People are gonna complain.
people are going to ask for the clean Negroni. Like specifically. It happens every time.
Yeah. Jessica. My dear friend Jessica.
Huh?
Are we maxed out on the recipes we can stock, like, in the food truck?
Yes.
Damn.
It's only 7 recipes per truck.
That's crazy.
Uh-huh. That's why I was thinking about buying a 3rd truck
Mm-hmm.
and having a lunch menu in there.
Yep. Like a
Think that's
bistro
where-
menu or something.
Yeah, like that's where we could have like a margarita pizza. We could have like a
I know a ton
you
of...
know, like Italian sandwiches and stuff.
Ooh, no, I love an Italian
Yeah.
sandwich. That... Ooh, Jessica. I love an Italian sandwich.
I know.
I know some
I was
folks have
thinking
asked
about
for,
it.
like an espresso.
Mm-hmm.
Because I know we're an Italian place. And the other kind of coffee places don't just do, you know, straight up espresso. Like true
Yeah.
Italian espresso. I've had people ask me for Italian wedding soup. With like the little meatballs and stuff in it.
Mm-hmm. Yeah.
Yep.
The only thing that sucks is we can't have 3 trucks open at the same time. You can only have 2 trucks.
Mhm.
So
Well, with like the lunch/bistro menu, you would only open that one truck.
yeah.
And then the other 2 trucks you can either open as a set of 2 or as the singular. So I don't think we would ever have to worry really about 3 trucks being open at the same time. Because, I mean, really, it would be kind of weird, even with the set of 2 that we have now, if you took one truck and opened it, like, in Sandy, and then took the other one and opened it down here, like, in Little Seoul. It would be a little bit weird.
Yeah, it would.
Yeah. So I don't think that will be an
Because
issue.
I couldn't put a directory ad for both.
Yeah, exactly. So I don't think it'll be an issue because we would never. I mean, we hardly ever now open 2 trucks at the same time.
Yeah. It's just, it's too tough.
Mm-hmm.
I wish that if I owned 2 trucks, I could make all of the food in 1 truck. As
Mm-hmm.
long as I owned 2 trucks and had the menus in both those trucks.
Right.
I have a question.
What's up?
Okay.
I noticed this patient, fear phospholite?
Mm-hmm.
Whatever.
Yeah, they
It
were
says
an
in her
ICU
note-
admission a while back.
Yeah, it says they were in the note discharged into PD custody, but they're still in ICU.
Who's the note of who discharged them?
Olivia Kelly. Dr. Okide.
Alright. Discharged into PD custody. Let's remove him from the ICU. I would contact Dr. OK, but she is currently on vacation. So...
What?
Yeah, she's on vacation. She's visiting family. And I think she had some kind of academic conference to go to.
What?
Yep. She won't be back till Monday, and my heart is very sad about it.
Sag.
I'm very sad.
I won't get to see my Olivia.
Yeah.
Mm.
You need to read her ECs, by the way.
Olivia?
Yeah, her ECs are so cute. She changed it.
Work wife. Aww.
Yep.
Aw.
Yeah.
I'm not just a coworker. I'm one of her people.
Mm-hmm. She has actually
If
been
she's
getting
concerned, take it seriously.
Yeah.
Yeah, it's true.
Mm-hmm, mm-hmm. She has also actually been getting out of the hospital. And like
What?
yeah, she got hired at Limey. She's been working there. She talked to me about potentially being hired at Payne's at some point if she
Yes.
feels like she wants to work a food truck, and I told her just to call or text either one of us and she'll be hired immediately.
Yes.
Yep.
Immediately.
So she might do it, she might not, but she mentioned potentially being interested.
Hell yeah.
Mhm.
I love that she put medical notes on her profile. Has a history of falling from heights. Please don't let me on roofs.
She says, but then takes us up there to do shift lead meetings all the time.
Yep.
Which, granted, we typically are just pacing around and yapping to try and figure out how to solve a problem, so we don't typically get close to the edge of the roof, I guess, which is what might make it okay.
Yeah. Oh, I need to go through my Mercy contacts.
Yeah, I just redid mine the other day.
Removing Layla. Probably removing just here. Okay. I think I'm going to go 42.
Gasp.
Uh-huh.
You're leaving us.
I'm sorry.
Nar.
I'm tired.
I know. I just like yanking your chain.
I'm like... about to do this.
Oh, gotcha. It's okay, Jessica. It's okay. You can go 42.
Honk.
It's okay.
Honk shoo.
Honk
Me, me, me,
shoo.
me, me, me.
Me. Do you need food before you go? I think there might still be some in the
No,
fridge.
I just ate some.
Oh, the fridge is empty.
Yeah, the fridge is empty.
Oh well.
That's
Rip.
because as soon as you got those meals, everybody came on duty
Mm-hmm.
and was
Yep.
hungry.
I ordered for 4 people and then like 5 showed up.
Yeah.
Or 2 more people showed up. Which, did you notice Theo was like, I'm going on call, and then he stayed around the hospital the entire time?
Yep.
Yep. He was just watching me do a surgery. It was weird. Oh well, it is what it is.
Hey, Indy.
Oh my god, my wife, you've returned from war. Which is hilarious, because Santi knows about the work wife thing, and he was just like, yeah, that's fine, have fun. I was like, okay. That's not an animal, that's my wife. Wow, she's so cool.
This is my work outfit.
Yeah, honestly, throw a stethoscope and some gloves on it. It's a great work outfit.
No.
Yeah, do it.
No, no, no.
Do it.
No, no, no. My
Oh.
work outfit.
Your work outfit. Gotcha. Okay. Still looks cool.
I need to get rid of this outfit. Done.
Nice. You look cool though. Very, very cool.
I need to add a helmet to this.
Who's running around? Is that Anna? Yeah, it is.
Probably.
Yep. She human. She's close to getting ready to be promoted to doctor. There's some stuff I need to run her through verbally. Because otherwise
yeah.
it's never gonna get done.
How do I look?
You look ready to practice motorbike safety.
Yeah,
Yeah, which is perfect.
it is.
Yes.
Because my Kuma's parked next to your Kuma.
Nice. I need
I was
to get
about
it
to park in a
renamed.
different spot and I saw the pink Akuma and I was like, nope, parking next to Indy.
Nice.
But what does Hannah have left? Let me look.
It's basically some of its SOP stuff. A lot of it she's already been put through. She just needs to like have that final checkpoint. So I'll probably do a couple of those while we're waiting on a patient to come in. And then the other stuff is just I need to see her like treat a stab wound.
Yeah, like psych reports that could
Yeah,
be
I could
signed off.
literally sign her off on that tonight. Knows about
The
performing
custody that could be signed off.
amputations.
Notes, info in the medical profile that could be signed off.
Yeah, I think I'm gonna focus for the rest of tonight on getting her SOP stuff checked off. That way it's just...
Yeah.
We can verbal quiz everything in the, like, treatment. So at least she gets the presented part of it marked off, and then it's just waiting to see what comes in. Because we need to see her treat it.
I
So
mean,
we
just
could...
like basic life support, that's easy.
Yeah, we can verbal quiz on that. That's not a big deal. I already checked her off on quite a bit of stuff today because I had her do... It was nearly a Serlo surgery. The only thing I had to do was start up an IV because she was already in the patient on the Da Vinci.
Yeah.
So I took care of that, and then I also clamped the muscles in the proper place, but then she sutured them. So it was pretty much a solo surgery.
Yeah.
Actually,
do you want me to go stab somebody so she can get stab wounds?
No. No, I don't want you to do that.
Okay, fine.
I mean, who knows? Maybe if you get caught, the judge would let you trial by combat at it, but that is, assault with a deadly weapon. Smile.
No, I'm not. No, I'm not going to do it. Yeah, she should be done in no time.
Mm-hmm. Yeah, I think, like... This shift, if I get her marked off on all the SOP stuff, if I have time to, like, sit and talk with her. And
yeah.
I think I'm only going to be around maybe another... I'm not going to say the exact time, but maybe an hour or so.
Yep.
I think that should be time to at least get her through the SOP things, and then we can focus on actual treatment procedures next time she's around.
Yeah, I mean, I was supposed to help her out tonight, but you were on duty, so
Yeah, well, she
I
was
was like, cool. At least she's
supposed
getting
to-
some training.
Yeah, she was supposed to be training with Ember today, but then Ember never came around. But I
No.
did. So
Oh,
she
yeah.
texted me and was like, "Hey, I was waiting on Ember, but I see you're on duty. Can I just shadow you?" And I said, "Yeah, sure, come on."
Yeah.
I thought about saying no, because when I clocked on at first today, I was really anxious for some point when I clocked on duty today. But it's not been
Yeah.
bad.
Oh, yeah. Actually, I'm gonna go talk to her real quick.
Yeah, for sure.
I'll be around the rest of this week. Should be.
Okay. That'll be good.
So, probably about the same time tomorrow, and then this weekend I will actually be around. Last weekend was kind of tough for me.
No worries.
So,
You take priority, of course.
yeah. So we'll get you all trained up. I mean, you're close anyway, so.
Yeah.
Oh yeah.
Oh, we have a 47 not far from here.
Yeah, I heard over radio.
Yeah.
Mateo's bringing someone in.
Uh-oh.
Uh-oh.
Hi, Mateo.
Hola.
Hello.
I got someone with boo-boos. You are
Oh,
very well
no.
acquainted with her.
I believe so.
Owie.
Owie.
Ouchie.
Dr.
She
Payne,
ran into a
742,
tree,
good
I
night.
believe.
Good night.
Ouchie.
Alright, what happened?
I hit a tree and I flew off my bike. Like little
that's
bike.
no good.
Yeah.
Let's have a look. I can see some discoloration on your leg. What's your pain scale at the moment?
Like 6, 7, I guess.
You guess?
Uh-huh.
Well, you're not screaming at me.
Well, I have a high pain tolerance. I don't know. It's probably more, but I'm just used to it. You know, it's just
Does
numb.
this happen often, does it?
Yeah, since I was little.
Okay.
Not the
Well,
falling
let's,
off bikes, but the pain.
Oh, I'm sorry to hear that. Let's have a look.
Tea.
Just make sure nothing's broken. Doesn't appear to be. So what I'll do is I'll just get you some ice packs and some bruise cream. Do you think you'll be able to stand on it?
Yeah, it should be okay.
Alrighty. Let's get you comfortable, and we'll see if you can put some weight on that leg.
It's okay. Yeah, it's okay.
Well, good.
Oh, it should be okay. Hopefully.
Where did you fly off your bike at? Oh, literally right down on Eclipse Boulevard?
Mhm.
Okay.
Yeah, but it was coming here because I flew off before that, and I was like, ooh, I need to go to a hospital before
Gotcha.
fly
Okay.
off again.
Yeah.
But then
freaking local got in my way, and then I swerved into a tree, and then I was over.
Oh, gotcha. Okay.
Mm-hmm. You still gonna be on duty?
Yeah, I think I got about another 45 minutes or so left in me, then I'm probably gonna go 42.
Okay.
Yep. It's a hospital day.
I'll see you at the house.
Okay. Rest well.
Okay.
I want to run you over some SOP stuff so I can get you checked off on it. Do you want to sit outside? That way we can actually have some fresh air. We've been inside almost all
Yeah.
night. Later. Be safe. Alrighty. Can you go to my profile and demonstrate how to add a medical note?
Yep. Here you go.
Perfect. You can go ahead and delete that, and I will mark that off. Alrighty. If you needed to find a phone number, how would you find it?
Well, I actually do not have access to that on people's main profiles.
That's good enough for me. You know it's on their main profile.
I assume that's a main doctor thing.
Yeah, I'm sure it is. Basically, when you get full access, right underneath a person's picture, like their name, and things on that left-hand side, there will be a little box that will have their phone number. You can get it from there.
Yep. I do also know that if I get a call from an unknown person, I can go into the search everything and I can like copy that phone number in the people and it will give me if that number is attached to anyone.
Mm-hmm. Perfect. That is incredibly important when talking about privacy, patient privacy, ECs, all that kind of stuff. Because I've had people call me before with numbers that I don't have saved in my phone, and they give me a name, and I'm like, give me a second, let me double check. And then I have to go quickly look up that phone number and make sure they are who they say they are. Because otherwise it would be a violation of patient privacy.
We don't want to be fed to a hippo.
No, we do not.
They're very dangerous.
Yep. What are psych reports for?
Well, for psychiatric evaluations, for to see if someone is well fit for like work. Say if a police officer had to shoot a suspect and that person ended up passing away. they might be very affected. They would need to be psych eval to return to duty. See if they are not so affected that it would affect their work. Same with us medical staff. If when we deal with DOAs or something, if it affects us, it'll affect our work.
Right. There is one other instance where a psych report would be used. Try and think of something.
There are a few. People, stuff like Article 12, if they're fit to stand trial. There's also, I've heard of one recently. Someone was charged with capital punishment. However, they needed a psychiatric evaluation first. I'm not quite sure what the context was, but did not.
Yep.
Stuff like that, to see if they were even fit for rehabilitation.
One other thing that they are used for are notations of therapy appointments. Yep. Which is why you don't see therapy appointments in our typical medical reports. Those are psychiatric reports. I don't think you can
Are those
see
tied
them.
to? I was going to say those might be tied to the certification.
Yes,
because
those
I
are
cannot
tied
see
to
them.
a certification. I also cannot see them. Hey Jess, what's up?
Hey, Indy.
Hey.
Delika's in not in his normal pizza. He's another one.
Okay, appreciate it.
Yeah.
Did
Because
you
I
get
just
pulled
got
over?
pulled over.
Yeah, okay. Alright, I need to let you go. I got some patients, but thank you for letting me know.
Okay, bye.
Bye.
Alright, that stopped the bleeding.
You so
Alright.
much.
Does anybody else need bandages or anything while you're right here?
I'm all good, thank you though.
Yeah, of course.
Thank you so much, Doc.
Does anybody else need me?
I could have something like that. And got into a little scrapesy earlier.
Hey,
like a
nobody
bruising.
causing you guys trouble at the hospital lately, right?
No, we're doing all good.
Alright, good. You guys need any food delivered?
Oh,
Yeah,
I actually
I
wouldn't
know
mind
the
like
owner
a
of
one
Tito's
and one.
Tacos.
Bandages tightened.
Yeah.
Is it just a one-on-one?
Hana, do you need any food?
Appreciate that.
No, I'm actually good, thank you.
Okay. If it's just a one and one, don't worry about it. I can vending machine snack. I don't want to push y'all out for
I
just
can,
one thing.
I'll see
Yeah,
if
'cause we're
someone's
not gonna
around
be-
to bring it by. Just to help you guys out. You know, it's nice
Oh.
having doctors here late night.
Well, I appreciate that very much. Thank you.
Yeah.
That's what I'm training to be. I'm gonna be.
Yep.
When I get certified, I'll be around for.
Be your shift 3
now
doctor.
until, yeah, now until basically until Storm.
Oh hell yeah. Well, I see people being stupid here all the time late at night, and well, I deputize myself around these hours sometimes. Okay, so if you need help, you'd call us.
I appreciate it.
Absolutely.
Because if we run someone over while running the lights, we'll still help you with a gun. We won't get fired.
That is true.
Fuck Sergeant Sloan. You know, I pissed in her office and VPD. You look on my Twister, it's actually.
Hi.
Hey Nora, how you feeling?
A little rough right now, to be honest.
Alright. We can get you set up with your antibiotic drip, and we can get you some pain meds, okay?
Okay, thank you.
Yeah, of course. That is one thing to note, Hana. If you are gonna be around these hours. The Vagos are very, I don't know if protective's the right word. They have a very strict rule against starting shit in the hospital. And they will
Okay.
legitimately hunt other groups down that do it. They hold medical staff in very high regard. So do your best not to piss them off, because it is useful, in a way, to have them kind of looking out for us.
That is good. No, I've been, I guess, down to that area a few times to get food, and I've spoken with them. They seem very nice.
Yep.
Oh, that explains. So when I was getting food, and they were like, "Yo, you're getting food for everyone else, right?" And I said, "No, I'm only a resident doctor. I don't have that much." They said, "Oh, here, take my food."
Yeah, the Vagos are
That
very good to
explains
medical
that.
staff. So do your best to be kind back to them.
Oh, very. Well, I want to be nice to everyone.
Well, yeah, of course. Alright, we're just gonna get a doxycycline drip set up, and we're gonna get you a little bit of ketorolac going on.
Thank you.
Didn't we want to avoid that because of the blood thinning?
We were, but I believe we've not had any leakage since we put those sutures in. So I think it will be okay. What we'll do is we'll have the local nurses monitor overnight, and we will switch to probably a morphine drip if we start to see any issues overnight.
Okay.
Yep. Here you go.
Alright, thank you.
Yeah, of course, anytime.
Okay.
Yep. Hope you rest well.
Thank you. You guys take care.
Will do.
Did I see someone with duct tape on their head
Potentially.
come through here? Or...
I saw someone, like, they were in, like, a blue shirt.
Yeah, blue.
Who knows? They might have seen we were treating the patient and just dipped. I think all the doors are locked, so...
Oh my god.
Oh. Hello.
Hello, Puppet. I think my wheelchair's a little broken.
Yeah, I would say so.
Do you happen to
Are
have
you okay?
I'm okay, Puppet. I'm looking for some cocaine if you have any.
Unfortunately, we don't keep that here.
Copy. Passing Limitless, passing the
Give me
bank,
just a
passing the
second.
ranger station. Still westbound Route 68.
I have someone I can call.
Do they have some of the cocaine?
Probably not, but they can
the
help
Roach
get
Motel,
your
still westbound Route
wheelchair,
68. Full sending it, crossing Joshua.
less
Oh,
broken.
lovely.
Major 33 is going to go southbound Great Ocean.
Hello.
Route 68.
Hi, hun.
Copy. Still full sending it,
What's up?
westbound Route 68.
Would you be willing to clock into tow to help us remove a car from the lobby of Eclipse?
Gun Valley westbound.
Sure, I can do that.
Wheelchair.
Cool. I mean, yes, a wheelchair from the lobby of Eclipse.
Yes, my wheelchair.
Wheelchair?
We have a very confused old lady here, and I think she tried to drive into the hospital, but thankfully her car got stuck. But
Yeah, I can go grab one real quick.
I would appreciate it. Thank you so much.
Sounds good. I'll meet you up there.
Yeah. Just be safe. I love you.
Love you too. Bye.
Bye.
Back onto Main Street, northbound Galileo Road.
that one for you.
Still eastbound Galileo.
What's
Left northbound
flying,
Victory
man?
Canyon, back towards Sonora Road.
Just to be completely
Continuing
candid,
eastbound
we might
Victory,
not
approaching
want to be
Sonora.
standing this close.
Do you need assistance?
I have a unit coming.
Alright.
Just in
Think it's
case
fine.
it decides to
Right,
remove
southbound
itself.
I mean,
Sonora.
it's stuck. I don't think it's moving anywhere.
You okay?
Passing the place for the flying cows, still southbound Sonora Road. Approaching La Fuente Blanca. Passing La Fuente Blanca, still southbound Sonora.
Ranger 33 is, if there is a unit in the city that has a better intercept point than us, please, by all means, attach.
We're about to enter Harmony is what we're trying to get to.
You may tunes on Howick. Eastbound, I'll try and cut to Elgin.
Copy, you're still westbound Elgin now. That's gaining a bit of distance to right, westbound Clinton. Left southbound Meteor. Oh, I-50. They sent us southbound Meteor. BCB.
What's southbound Meteor?
Nothing came this way. I did hear a BF 400 or
Westbound
a
San
bike.
Andreas. Stand by. What was the description?
Male, white shirt, black mask.
Oh, you got the
no,
Mona
not that.
started.
Never mind.
Good job, Puppet.
Copy. We can call it UTL. He's long gone by now. Back to Nate.
The wheelchair.
Have we had any sightings of Jimothy Slim tonight?
I'm sure we'll get him this time. He won't slip away.
Well, it was going.
He slipped away 3 times.
1876, that already
I
stopped
thought I really
pretty
had
much
it.
in front of it.
I'm sorry.
The Bluetooth out of there.
Well,
We can at least get it put back on the road, then maybe you can call for a wheelchair repairman.
yeah. I'll see if one's available.
I think I saw that Hayes is open.
I don't see anybody.
Ooh, Blackbird.
In the back.
True, Blackbird. Blackbird is closer.
Yeah, looks like it's right up front here. I didn't see anything coming eastbound.
No, I didn't have anything come southbound. BF 400 just went westbound, high rates of speed, passing Eclipse, BCB.
Hello, do you do another?
Looks like they're going. Yeah, I caught it speeding too.
Hello, Puppet. I think my wheelchair's broken.
Yeah, I think so. We're trying to get somebody to come fix it for you. Godspeed. We'll at least get it towed
Should
out
we-
of here.
Should we chase her? That is an
I'm
old lady.
I'm going to put this as gently as I can. We'll see her again.
Lima 3876 as well.
Yep.
Yep. Sometimes you just gotta let them get their energy out somewhere else.
Lima 3823, we've got an individual standing in front
Considering
of
she thought this car was a wheelchair
black and colour penumbra out front.
and looks like she tried to drive it into the hospital. If she had made it into the hospital, that would have been an issue. Thankfully, she
this
was
is-
stopped at the doors.
This is a regular salt. This is a Sultan
This
classic.
is somebody's Sultan because it has a green pearl on it. And she more than likely stole it.
Oh my goodness. Yeah, this is someone.
Yeah. So it would be good if we could get it to the parking lot over that way and let whoever owns it just find it.
Discover it.
Yes. That way
Can
they
you
don't have to pay.
hotwire?
That's why we have tow truck. So we don't have to. Hey there.
Whose car am I fixing?
It's this one right here. Once we kind of
Oh.
get it moved out towards the street.
Oh, okay.
Yeah.
Okie dokie. Who the fuck tried driving into the
A
hospital?
delusional old lady.
What the fuck?
Oh my god.
Yeah. She kept calling it her wheelchair. And kept trying to
Oh.
drive in, and then thankfully it kind of broke and didn't get all the way in,
Oh.
otherwise she would have probably run us over.
Oh my god.
Oh,
Yeah.
that's a little terrifying.
A little bit. And anyway, she ran across live traffic and went down that way. So we'll probably see her again at some point.
Oh, goody. I'm so excited.
Yeah.
At least nobody got hurt, I hope.
No, thankfully. I mean, she was perfectly healthy. It's just the car,
Damn.
really, that got
Yeah. Oh.
busted.
Yeah.
I come bearing food.
Oh my god, thank you. I'm so hungry.
Left northbound power, upper power.
Who am I charging to?
22
Me.
lower power, so northbound.
16257.
Left westbound integrity.
I'll remember one day.
You're good.
Left southbound Alta. Right westbound Vespucci.
Thank you.
San Andreas. Left southbound Peaceful, approaching
Get
Vespucci.
some one free Gia?
Left eastbound Vespucci.
Yep.
Right southbound
One for each.
Alta.
Perfect.
Or do you want to stay here with them and I'll go help with Delica?
Yeah.
There we go.
They go.
Eastbound Benny's alleyway into another alleyway. Taking the Olympic squeeze.
You're welcome.
50.
Have a good one, guys. Good luck with your wheelchairs.
Thanks, Holly. Appreciate you.
Squeeze, eastbound. Right southbound Elgin, right westbound to the alley again.
Should I just throw it right here?
If you don't mind, can you throw it in one of the parking spots back there? Because that is somebody's. I don't know who she stole it from.
Alright, I got you.
And I'll come around and pay for the repair.
So southbound or right southbound Strawberry.
You may have seen us attached to this area.
Sending it southbound Strawberry, transitioning Davis. You can get a channel for this if you want.
Channel 2?
Channel 2.
Copy, channel 2.
Alright, well we've got another 80 with a black and yellow penumbra with northbound Elgin. We've already got enough units, so can we get a channel?
Channel 3.
Copy, channel 3.
Oh god.
You good?
Yeah, if you want to get fixed up, I can just adjust it after.
Alright, who am I charging?
Me.
Okie dokie. What's your
Yep.
state ID, please?
16257.
16257.
Yep.
Okie dokie.
I'll barely have made any money today. Tito's is too expensive.
Yeah, Doctor's PD.
Send.
Send it. Sorry, I turned off my radio. Wait, Doctor's PD.
Send it.
Send it. Sorry, I got one Bozo, Silver, or Mario in the ER. Are you guys able to help her out?
Silver
Not again.
Amaru.
Yeah, she referenced you by name, Indy.
I should hope
Looking.
so. That's my sister.
Can you treat her then? Do we need hand
Yes, we don't have I forget what the phrase is, but yes, I can treat her.
She's tripping all over me. Please help me. Oh my gosh, she's getting her blood on me. Yeah.
Are y'all in the ER?
That boy.
We're in the
We're
lobby
about to
now.
need an
We're on our
ICU
way.
room.
Oh, that's awkward.
Ouch, ouch. Help me.
Why
It
are
was
you
all her
bleeding
fault.
on pork?
Help me.
Help
Jason tried to
me!
kill me.
I just got 20
Which
billion
officer?
new diseases.
Jason.
I don't like shots.
So, dispatch show channel
tried to
2
kill
collapse
me in-
GTL black and color beer 400.
What
occupied
happened?
1 male wearing purple.
You're lucky
around
you
the
Yeah,
alley.
happened to me
survived.
on the phone, and then he paid off people to run me over.
Oh my god.
I did do all of that. Yep.
Park.
Sorry,
He
I
tried
just
to
had to
kill
get rid of my
me.
biggest hater.
I'm not your biggest hater.
No, I paid them off to do it, but they all suck at it. I gotta pay the locals more.
Yeah, they tried to run into me out while I was getting here.
Oh my god.
Cause they paid him off, so I said I'm gonna put a hit out on him.
Oh, I see.
So close.
I see. Alright, I think I've got you pretty well bandaged up. How are you feeling?
I might need one more.
There we go.
Cause I was feeling
Feeling a little rough prior?
Yeah.
Gotcha.
Okay. I think I'm okay.
Well, good.
That's that assassination attempt didn't work.
Next
Thanks for
time.
saving.
Did another tree jump out in front of you, did it?
No, actually, like the locals were paid off by Jason. This guy tried to kill me. Just so you know.
Should I try it again, Indy? You think it's worth?
I would prefer if you didn't.
Like that.
Nice one.
You get 24
Take
hours,
that.
bucko.
Okay, but only a few.
Thank you guys.
No worries. Take care.
See ya.
I'm gonna check on that car and make sure everything went fine.
Oh, it's fine. I
Oh,
moved it
okay.
off the curb, and it's very much hot-wired.
Yeah, I suspected as much, unfortunately. I hate that she actually stole someone's, car.
Normally they can't be lockpicked from the outside.
Yeah.
So someone left it unlocked, and then she got it from the inside.
Wow.
Crazy.
That is wild.
Wait, I thought I'd have another opportunity to present my proposal. But I have a phenomenal presentation package. Frankly, I think you'll be blown away. Honestly, you have my best work, and I'd really like another chance to...
Listen, pal, it's a bloody glove box, right? How long could it possibly take to fix it? Sort it out, alright? Please.
For real, so get away from me.
Fantastic. Call me as soon as it's done.
19 transition channel 2.
Incoming 13 Bravo, it looks like. Potentially, anyway. Alrighty. To the best of your ability, can you explain to me triage protocols?
Okay, dispatch limit 95, 1042.
Triage protocols is a way to separate patients in how urgently they need care. It's normally separated in colors. Green meaning they do not need care, yellow meaning they would need care but not as urgent, orange meaning they need urgent care but not life-threatening, red meaning they are in life-threatening danger, they need urgent care, and black meaning they are dead.
There you go.
Can we go to the Bravo?
And black, I mean, they're not going anywhere, so they don't need to be seen before anyone else.
Yep. Always prioritize the living.
Anastasia, what you
Because
do?
they're the ones that could become
Yep.
dead.
Bravo's on channel 2.
Yep.
Yep.
It's in the tunnel? I'm going in the tunnel.
It looks like 002 is with the Bravo.
Alrighty. You have a doctor, a PD member, and a citizen, all with the exact same type of wound. All of them need care urgently. Which one do you treat first?
The doctor.
Alright, who's second?
Probably PD.
Yep. Then the citizen.
Yeah.
To be more realistic, the doctor or EMS is always first. You treat medical first. Sometimes, depending on the situation, depending on if people become more critical, you might change who gets treated when. But a good rule of thumb, always treat the medical first. Because they have the potential of getting back up on their feet and helping you. And then they're able to spread, and then you could treat the PD and the citizen at the same time. If they can get up and help you. In reality, sometimes it becomes, who can I get my hands on first? That's just the reality of, like, 7 or 8 plus person MCIs. We do our best to triage. Typically EMS assists us in that regard. They'll write down who's suffering from what on their beds and things of that nature, and then the doctors can assess and be like, this person is the most critical, they are going into surgery first. It is not always, you will not always have time to assess every single patient. Sometimes you are just going to see a critical, grab them and go. That is why we have Dr. Nancy and the local nurses. They can assist in stabilization of patients. So it is not necessarily a hard and fast rule, but keep it in the back of your mind, criticals go first. Dr. Nancy can stabilize other criticals until a doctor can get to them. Dr. Nancy can fully treat people who are yellow and green. They should not need to get seen by us. They can always come back and we can tighten their bandages later. It would be great if everything worked out like, cool, we're going to do this, 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 and this. Sometimes you're not going to get that opportunity. MCIs are hectic, PD are loud. They're going to yell at you and be like, why hasn't this person been treated yet? Because they don't know our SOPs. Just do the best you can with what you see directly in front of you. Dr. Nancy's team is great, even though she's an annoying bitch. We will get to everybody eventually. Alrighty, next. Tell me everything you can about patient confidentiality.
Well, patient confidentiality is like that. Everything told to us gets sealed away unless they want it to be told. If the person is an emergency contact, we can tell them the nature of their injuries, where they are, but that's generally about it. We don't say anything to outside parties, even if we're asked.
If someone comes up and asks you if a person is in ICU, what are your steps?
Well, no, I would ask them for their name, and then I would search for the person to see if they are an emergency contact. So I would say just, who are you? And then one moment. If they are, I would ask to see an ID. Unless I specifically know them. Like, at this point, you or
Yeah,
Silver.
eventually you'll get to know folks, but if you genuinely do not know them, yes, ask for an ID.
And then, if I can confirm they are related or anything. Oh, sorry.
You're good.
Or an emergency contact, because people can be related, but then not be an emergency contact. Just as long as they're an emergency contact, I would let them know.
Yep.
If not, I will say either no or I cannot give out any information.
I would
I
always
would probably just
recommend-
say no.
Yep, just say no.
Because if you say you can't
You're
give out any
basically
information, it
confirming
kind of
somebody's
alludes.
there. Yeah.
Yeah.
I hate when people say, ooh, I cannot confirm nor deny that information. You're basically telling them they're there. Just say, I haven't seen them. I don't know this person. Da-da-da-da-da-da-da. That's all they need to know. As an example, earlier today, when Jason Park asked over radio, how's Nora doing?
Yeah.
He wasn't
I had
an
to see if he
emergency
was.
contact. Exactly. Also, as a side note, we never, I repeat never, give out
Over radio.
medical
God,
information
no.
on radio. You never know who's on radio, who's listening in. There are people who are going to be on that radio who are not ECs. We do not say stuff over radio. If someone asks over radio, like today, if he had been an emergency contact, we say, I will check and see, then I will call or text you. We do not give out info over radio. It is a no-no. Big no-no.
Multi-channel thing. No.
Technically, everyone who wasn't Park on that radio would have had access to Nora's information anyway, being medical staff. But if there had been dispatch on that radio, if there had been another PD officer, if there had been a volunteer EMS, those are people that we cannot give that information to. So, never over radio. What are the situations where we would give out information on someone even though they are not an EC?
At the patient's request.
Yep, one more.
If a PD requests a medical report for an investigation.
Yep. Keyword, active investigation. And you can ask the PD member, ask them straight up, is this for an active investigation? If they say yes, give it to them. Because then, if they lied to us, that is their fuck up, not ours.
Yeah.
Yep. And then if they say, no, it's not for an active investigation, I just really like this person, I want to know what they're doing. Too bad. Not an AC. You're not getting that info.
Too bad. You want to be fed to the world's most dangerous animal?
Yup. Alrighty. Last question. A patient wakes up in the ICU that is in police custody. What is your procedure?
Well, you do the regular IC rounds, make sure they're alive, seeing if they're fit to be discharged, and if they are, you contact PD.
Nope. Contact
You-
PD first.
Really? Even if they're, like, not able to be discharged? Like, if they're in such a critical condition that they need surgery first, and
If
still
they
aren't able
are
to be
in
discharged?
a critical state where they're going to need surgery, you still would 311 and say, this patient is awake, they are going into surgery. A PD member will probably come assess, see if they can get a statement, and then if they can't, the patient will likely go back to sleep, and we would keep that kind of bed alarm on them. Always notify PD if a patient's in PD custody, because typically they are shackled to the beds.
Shots fired southbound from Strawberry.
That's interesting, because I believe I was told that you do the ICU rounds, make sure they're alive first, and then contact PD.
Let me double check my SOPs, because I might have been told. So let me double check.
He's not
I got cut by my own knitting needle last night.
Is he chasing anybody?
Negative. It's a female actually.
Circle was at my house this week too. I know. Usually we're knitting when that happens. We tend to use razor blades for the sacrifice.
Okay, it actually does not specify. So I guess technically you could do it in whatever order you chose to.
I mean, it kind of makes sense you make sure they're not dying.
Oh yeah. Well, definitely you make sure they're not dead.
I believe that was
But it also is a priority to contact PD once you're like, this patient is alive. Quick little 311, this patient is awake. They are still undergoing medical treatment, but they are awake. Let's see. The only big thing else in here, no visitors are allowed for ICU patients in PD custody.
Yeah.
Yep.
I did know that one. Absolutely none. Because they can come break them out.
100%. And then also... Oh, we've got a 78 as well. Do not allow any lawyers to visit before PD has arrived. PD can meet... lawyers can meet with their clients after PD come to check on them.
Looks like Thomas DeLica was... Oh, that's a lot of 71s around there. Oh, no.
He called out elder lady on a motorbike. There was that thing down there.
Oh, no.
Yep.
Well, we're gonna see you soon.
Given how far away the other PDs are, we're probably only gonna have DeLica come through.
If I see anybody on him, I'm going to open fire.
No, I mean, did you hear the the person who they were describing?
No, who was it?
Elderly lady.
Alright, 10 to him, we're gonna
Yep.
check around.
Well,
Yep.
I mean, I told you we would see her again.
Yep, we sure would.
Copy.
How did she get a gun is my
Don't see
question.
anybody in the immediate area.
How did...
We're gonna come provide backup.
Ooh, if she had a gun when she was here, that could have been very bad. Do you keep a weapon on you by any chance? That'll do.
I surrendered my weapons license. I'm a pacifist.
That's fair.
Yeah.
I keep a
But
gun on
I
me.
have a...
I'll take care of him.
I mean, I'm really rethinking all that decisions, but it's probably best to not have them in case we get held up.
They're gonna get guns from other people anyway. That's my thought process on it. Also, I label my gun.
Hey, Cleo.
Yep.
How do you label them?
We have label makers, or label printers in the shop, in our little storage, but they will only label the flashlight and the gun. The adhesive does not stick to anything else. They're kind of useless to have, If you want a label for your flashlight, I can make you one.
We do have doctors on duty, right?
I need to check if it still says that I have it. I remember I gave it to them, and they said they would like manually suspend it and then add a note to my profile, but it's not there.
Copy, I can get
And
it.
it doesn't say that it's suspended.
It's gonna be to the eastern of
I don't know.
002 has this one
Oops.
over near the clothing store.
Copy.
Alright, Delica should be good to be moved. We're gonna go ahead and get him loaded up.
I don't have any casings over here. So I presume the person shot from the
Alright. Can one of you guys from the Ranger truck take his bike? Nat can't drive at the moment.
Hey! I sourced a new color of yarn!
Nailed to the yarn.
Wait, did you copy?
That's one of Delica's emergency contacts that just ran through.
Wait, one of you guys take the bike because I cannot drive.
Ranger 33, we
what
can
was that
return
say?
to the bike. There's not really any
I
units
think
to
that's
meet us
Lucky
up there,
Beach. It's
so
one
I
of
don't wanna
Thomas
go up there
Delica's
by myself.
emergency contacts. She might be here waiting for him.
We're gonna go up there with you. It's just Nat can't
Yeah,
drive.
that's what she said.
I'll let the bike stay here
Cool.
and you guys can go.
Alright, Ranger 33, 76, EMT 113.
Doctors from PD.
Send it.
Send it.
6 Ranger 33, 76 Eclipse 147, 2 GSWs to the torso. Does not appear to be penetrating, but we didn't want to remove his vest on scene. He is conscious, he is talking. We're about 45 to 60 seconds out.
10-4, we'll take him in the ER when you get here. We're both out front. We can just take him back from there.
10-4.
I want you to take lead on this. You got it. Especially considering it doesn't seem that he's critical since he's conscious and talking.
Yep.
Robbery. Or grand larceny, depending on how much.
Wrong channel.
Yeah.
Hearing robbery out of the blue on Main is concerning.
Sorry, this was meant to be on secondary.
Here they come. Oh, Jesus. Wicked.
Oh.
Ranger 33, 23 Eclipse.
Hello.
Hello.
He's got a C-collar and is on a backboard.
10-4.
I just didn't have enough to clear the C-spine infield, so figured better safe than sorry.
Yeah, no worries.
Ranger 33 is 23 Eclipse. With all the units here, myself and Jay can head back down to the bike and go grab it real quick.
Copy.
films. Breathe. So it was 2 GSW to the chest, unsure if penetrating. I didn't want to remove the vest on scene. Let's get a look.
Well, at least there's doctors
Looks
now
like
you can get
one
looked
went
at.
through.
You can run again.
Alright. Did it go all the way through or is it lodged?
Yellow.
I twisted my ankle doing it the shoot,
Gotcha. Okay, I'll take a look.
and it's pretty bad.
Oh, yep, I'm seeing that.
That is
Definitely
pretty
got
deep.
some pretty heavy bruising. Let me see if
Alright,
this
I'm gonna
ankle's
give
bad
you
enough to be put in a little splint, or if it's okay if I just
are
kind
you
of
with me?
bandage it up pretty good.
Yeah.
Alrighty, buddy. We're gonna go to
Chest hurts.
surgery.
Oh.
Yeah, with a chest like that, it would be. So, what I'm gonna do, buddy, is I'm gonna hook you up with an IV. Can you?
Yeah, I'll take a look. Give me a sec.
Where are you responding to?
Hey?
Pain meds. I'm just
Okay.
gonna make sure that bleeding is under control.
Vince, are you at the
We're gonna go
HQ?
to surgery.
Thank you.
Yeah, it looks good.
Dr. Farah, we're gonna have to.
Yeah, I heard you. You're good to go ahead and take him back, get IVs and things started. Just don't make the initial incision before I get there, okay?
We're 76 back to Indy.
Okay. Alrighty, back onto the gurney.
Alright, it's looking like your prosthesis got a little bit jarred here.
My prosthetic?
Mm-hmm.
Alright.
Let me see if it's something I can kind of clean out and get fixed back up for you. Oh yeah, it looks like you just got a little bit of something jammed here.
Oh, that's positive.
Yeah.
Here.
Oop, there we go.
I was stuck.
Oh.
Okay, just making sure.
Yeah,
How's that
Everything's
feel
fine,
for you?
Everything's great, wonderful, awesome, amazing.
Look
You're
better.
lying. It's fine.
Awesome. Happy to hear.
Thank you.
Yeah, of course.
I can run without any difficulties. Thank you.
Yeah, no worries.
Alrighty. Hey, you're conscious?
Alright, go ahead.
Mm. I think he's out like a light.
Feeling alright?
One got lodged, the other one stopped by the vest.
Mm-hmm.
So now I'm just going to gauge how deep it went in, see if any vitals were hit. Okay, I think all the blood was just clouding it a bit, but it only went 2 inches in, just underneath these ribs here. No vitals hit.
That's good.
All looks like an extremely easy extract and repair.
Perfect. Looks like the vest stopped a lot of the bullet's momentum. We love to see it.
Yeah, love it. It was probably only 9mm. Those things.
True, not as much
Basically,
power,
everyone's immune
thankfully.
to 9mm.
Yeah.
All right. Let me just take my forceps and we're gonna go in and try to yank that out. Oh, look at that. Like a glove. I've pulled so many bullets out, don't even know. Yep. Now we'll just close all this up. And do a lovely little cross stitch on the entrance. There you go. Yeah, nice and easy. Anything of note, Dr. Farah?
Nope, you're good. I'm just jotting down basically the process of what you did so I can just kind of scooch it over to a medical report here in a second.
Okay.
Yep.
Alright, well, let's get this mask off and then hopefully he'll wake up in the ER.
Yep.
Gurney time.
Just be doubly sure to go through and tighten those bandages. Just typical procedure.
There we go.
Wonderful.
So how are you?
Nancy, is this going to be an outpatient observation ICU? We're just going to let him wake up. Kick him on out of here. No worries. Nancy says he'll be an outpatient.
Sounds good. I'm working on the medical report if you don't mind to hop in and just put what medications you used. I think I got the treatment debrief nearly done.
Oh,
Howdy, Delica.
hey.
Hey. How you
Hey.
feeling?
A lot better.
Good. You were treated by the lovely Dr. Kageyama here. She took care of your bullet wound. There was only one of them. We were able to successfully extract it during surgery, and you are slated to make full recovery.
Can I keep it?
Yeah.
Oh, yes, you can.
Nice.
You can just pass it
Start,
over.
I'll make a little necklace of them eventually. Thank you.
I wonder if that's something we can do. Make like jewelry out of 9mm.
Eventually. I think the only option we have for jewelry right now is the ones with like the rifle ammo.
The 5.56.
Yeah. That is something we could put forward as 9mm, though.
Because what uses 5.56 that people have access to?
I have no idea, honestly.
Feeling okay?
5.56 is
I don't know guns well enough to know,
that's
honestly. I
no
don't know what uses
5.56.
it.
That's like AK-47.
Ooh.
Yeah, no, those are big. That's not even like a single shot.
Yeah, I'll pass on that one.
Rifle.
I've been shot by an AK before, and I don't want it to happen again. So.
Oh no, yeah, go. That's a lot of damage. You do not want that at all.
Yeah. Actually, during
You
my
were shot by an AK?
Yeah. During my residency, actually. There was a lot of weird shit that happened during my residency.
Oh my god.
But yeah, I treated patients, still had the bullet in my arm. I was in shock and didn't realize I was in pain. Until I walked out of a room, I was covered in blood and my patient wasn't. And they were like, what the fuck's going on?
Yeah, that would have been very alarming.
Yep. Hang on, I'm getting a call.
I'm gonna put all this evidence in a report, make sure you get your statement.
Hello?
Hola, Dr. Indigo. I have a question.
Yeah, what's up?
You guys have those utility belts as doctors, right?
We do, but they're only for medical things.
Okay. They don't, You guys have the same ones that the police have?
No, they're separate. They don't hold the same things.
Oh, okay. Damn it.
Yeah.
Are yours, like, labeled as, like, doctor or EMS property or something like that?
I think they're specifically labeled as medical.
Okay, because I believe the other ones are not labeled anything. They just are utility belts.
Yeah, I think ours are labeled specifically as medical,
Yeah,
medical belts.
that makes sense. Okay.
Yeah.
I'm just trying to find out if I could get one.
Oh yeah, it has a medical utility belts.
Belt would be so much easier.
Sorry, can you say that one more time?
Sorry, I'm just trying to find out if I can get one if it's not police property.
Gotcha.
That way I can keep it because I have, things that I would love to be able to just carry around and put in it, It'd be easier.
Unfortunately, we don't have those listed.
No, you're totally fine.
Yeah.
Thank you.
It's no worries.
No, right. Bye-bye.
Bye-bye.
Was that each set of earrings was different bullets. They'd just been shot that much.
Yeah, I believe that. I mean, the amount of times I've been shot.
My buffalo was stolen.
Yeah, we don't sell those.
I don't know how the fuck it was stolen because it was off and locked.
Might have been towed.
Towed up into the hills? With its lights on?
Alright, well, we need to take care of that.
Guys.
Toads do have wheels, they can go round. Beamer 58, 40.
Yeah, can we prioritize getting that back, please?
Ranger 33 is mounting up with 002. We'll try and get eyes on.
Copy.
What was I adding to this?
Medications used.
We've got
'Cause
the
I didn't-
agent in our vehicle, so if someone could
I'm
grab
not certain,
a buffalo, that would be great.
Exactly what medications you used, like for anesthesia and things like that.
Can grab the nearest one.
Yeah, go for it.
Okay, I'm gonna take MRPDs. Is it actively moving?
I genuinely use
It
Propofol.
appears to be stationary at the moment, but we'll verify.
I'm open to suggestions. What other moderate pain relief that do you use that doesn't include any NSIDs?
Unfortunately, we don't have a lot of non-strong
No, it's not.
inset
moving.
options.
It literally was
Yeah,
stolen.
because I don't want to give people ketamine or morphine.
Yeah.
We
do have... Where is it?
But if Cataract makes them bleed more, while I'm also trying to TXA their wounds, it's just... seems
Mhm.
counterproductive.
Right. So we do have a document that is pain management info. If you are wanting something that is not an NSAID, one of the weakest options we have is extra strength Tylenol, prescription strength.
It was towed,
And then
no,
if
it
you
was not
want something
dropped.
that's a lower
The
chance
tow
for addiction,
crashed,
which
it
is
looks
why
like.
we use ketorolac so much, is so people don't really get addicted to it.
Alright, and we have
Whereas
the
morphine and other things
We're working
are
on that now. We're getting it documented.
are addictive.
Copy.
You could use tramadol.
Vicodin? No, not Vicodin. Goodness me.
No, Vicodin is actually moderate to severe. It depends on the dosage. However, it is an opiate. If you have somebody who was at one point addicted to opiates, I would be extraordinarily careful. And I would doubly sure and ask their permission before giving them tramadol. It is a synthetic opiate, and it has a much lower chance of addiction. But if you have someone, like you said, who's bleeding out, we try not to give NSAIDs of any sort, of which ketorolac is one.
County lieutenant. Same person just tried to murder me.
What?
Look, alright, I didn't know my own strength. I flipped the tow truck up onto its nose and it tried to fall on Jay.
Oaks, do you remember the bang bus? It's the bang bus all over again.
Okay.
If you want to. I've been meaning to, but never have, is make a little list of pain medications to use. That way you can have a list of non-opiate options. And then you can also mark down whether those medications are NSAIDs or are not NSAIDs.
There are no papers in it.
Because NSAIDs you are never going to use with a patient with a potential brain bleed. And if a patient is bleeding out, you are also never going to use NSAIDs.
Where do I find if it's an NSAID or not? It's not in the pain management.
Unfortunately, you gotta hit up the good old Google. Yeah. I didn't know ketorolac was an NSAID until I was looking up some dosage info. And it was like, oh, this is an NSAID pain reliever. And I was like, shit. Okay. $15,869. Alrighty. It is time for me to go 42. I will let you know. We checked you off on everything SOP related today. The only thing left before finishing your residency is you need to have some luck with what comes into the ER. And if you start just not getting luck over these next 2 or 3 shifts, we will start verbally testing you. So I would give it max another 5 shifts if nothing crazy happens. Before we're probably giving you your final exam to become a doctor. So you are very close. Don't let it get you down. The only thing left is actual physical treatment of patients.
Yep.
Yep.
Are they like really uncommon?
Weirdly enough, stuff seems to come in waves. So we'll get a lot of GSWs one week and then we won't have any for a while. Or we'll get a lot of stabbings in 1 week or druggings and then we won't have any for a while. It just depends on... Literally, it just depends on what comes into the ER. Whatever weird people are feeling like doing to other people that
Why is this
week.
thing so slidey? Jesus.
Yeah.
Alright, Ranger
Well, I'm
33
gonna
escorting one bad
rest in
tow
here.
truck.
Sounds good.
Have a good night.
You too, Hana. Take care. Doctors to PD on 1. Your medical are going off duty for the night. Please stay safe.
Good night.
The music in that joint is so ephemeral.
You should blog about it.
times 3, 15 should be about 1.5k. So realistically, like $600 because I paid for Tito's tacos like twice.